Well, good evening, everyone, and thank you for joining us. Could I ask people to take their seats? More noise over there. Good evening, ladies and gentlemen. We're ready to start the Public Board of Health meeting this evening. And as I said earlier, thank you all for joining us on such a terrible evening and terrible day in the weather department in the city of Ottawa. And I'm happy to see, quite a bit of people in the gallery, as well as those people that may be watching at home. We are online with this meeting, so if you couldn't make it out to us, we're coming out to you, reaching out to you. And thank you for that. So we'll start. First of all, there are no announcements for ceremonial activities this evening. So I'll ask our secretary to call a roll call, please.
Member Chernyshenko?
Present.
Member Fleury?
Si.
Member Kapoor?
Here.
Member Lakin? Member McKenney?
Present.
Member Pinel?
Ici.
Vice-Président Poirier, Chair Kadri?
Here.
Member Kakish?
Present.
Member Taylor?
Here.
Member Tilley?
Present.
You have quorum, Mr. Chair.
Thank you very much, Madam Secretary. And moving on, we do have two regrets, one from Member Poirier as well as Member Lakin. Unfortunately, neither one of us could join us this evening. Declaration of pecuniary interest, including those originally arriving from previous meetings. Any declarations? Seeing none. Confirmation of minutes. Confirmation of minutes of the meeting of February the 5th, 2018. Any changes to that, or can we confirm receiving those minutes? Carried. Thank you. There were 13 communication items that have been received and held with our board secretary. So, that's just a point of notice. Motion to introduce reports. Member McKinney.
Thank you, Chair. Be it resolved that the Chair of the Board of Health's verbal report, the Medical Officer of Health's verbal report, Ottawa Public Health's 2017 annual report, the Public Health Approach to Reducing Harms from Gambling in Ottawa report, the Acting Medical Officer of Health's submissions to proposed provincial regulations under the Smoke-Free Ontario Act 2017 and the Cannabis Act 2017 report, the Ottawa Public Health Emergency Preparedness and Response report, the Planning Approach for a New Public Health Strategic Plan 2019-2022 report, the 2017 Operating Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, the Delegation of Authority Contracts awarded for the period of July 1st to December 31st, 2017 report, the attendance at the Association of Local Public Health Agencies 2018 annual general meeting and conference report, the election-related resources policy report, and the report from the sponsors group on the recruitment and selection of a new medical officer of health be received and considered.
Is that carried? Carried. Thank you. So moving on to the consent agenda, item number 1, the Chair of the Board of Health verbal report. We will hold that item. Item number 2, Medical Officer of Health verbal report. Again, Dr. Etches has a report, so we'll hold that. Item number 3, Ottawa Public Health annual report. Are there any questions or comments, members of the board? If not, can we carry that item?
Carried.
Carried. Thank you. Item number 4, Public Health Approach to Reducing Harms from Gambling in Ottawa. We will hold that report as there is a presentation and there are a couple of public delegations. Item number 5, the Acting Medical Officer of Health submission to proposed provincial regulations under the Smoke-Free Ontario Act 2017 and Cannabis Act 2017. The recommendation is that the Board of Health for the City of Ottawa Health Unit receive the Acting Medical Officer of Health submission to the Province of Ontario in response to proposed regulations for the Smoke-Free Ontario Act 2017 and for places of use under the Cannabis Act 2017 as outlined in Document 1 and 2 respectively, and approve the recommendations contained therein. We have we do have a public delegation, so we'll hold that item. Item number 6, Ottawa Public Health Emergency Preparedness and Response. There is no presentation for this, and we have no public delegation. And the recommendation of the report is that the Board of Health for the City of Ottawa Health Unit receive the report for information. Can we receive that?
Received.
Received. Thank you. Item number 7, Planning Approach for New Ottawa Public Health Strategic Plan 2019 to 2022. And again, there's no presentation on this, and we have no public delegations. The recommendation is that the Board of Health for the City of Ottawa Health Unit approve Ottawa Public Health's planning approach for the development of new strategic plan for 2019-20 and 2022, as outlined in this report and attached document. Anybody have any questions or comments? If not, can we carry that item? Carry. Thank you. Item number 8, 2017 operating budget year-end results, Board of Health for the City of Ottawa Health Unit status report. And again, there is no presentation and we have no public delegation. And the two recommendations are that to receive the 2017 operating budget year-end results for the information and approve the transfer of $345,000 from the Ottawa Board of Health Technology Fund for the development of the electronic public health records project. Any comments or questions on that from board members? Seeing none, can we carry that item? Thank you. Item number 9, delegation of authority. Contracts awarded from the period of July 1st to December 31st. And again, there is no presentation and we have no public delegation. The recommendation of the report is that the Board of Health for the City of Ottawa Health Unit receive this report for information. Can we receive this report? Thank you. Item number 10, attendance at the Association of Local Public Health Agencies, ALPHA, 2018 Annual General Meeting and Conference. The recommendation of the report is that the Board of Health for the City of Ottawa Health Unit approve the attendance of members Kapoor and Lakin at the Association of Local Public Health Agencies 2018 Annual General Meeting and Conference to be held from June 10th to June 12th, 2018 in Toronto. Any comments or questions on that? If not, can we move the approval of the two members to attend this conference? Carried? Thank you. Item number 11, elections-related policy, and again, there's no presentation. That the Board of Health for the City of Ottawa Health Unit adopt the City of Ottawa's City of Ottawa's election-related resource policy as described in this report. Any questions or comments from the board members? Seeing none, can we carry this item? Thank you. And then there's an in-camera item, item number 12, report from the sponsors group on the recruitment and selection of a new medical officer health. It is an in-camera personal matters about an identifiable individual reporting out following council approval. This report, you were circulated as a confidential report. So if you like, we can carry the item or we can go in camera after this meeting. Carried? Carried? Thank you. And so moving back to item number 1, which is my report. Good evening. Bonsoir. I would like to begin tonight's verbal update by recognizing that we are meeting on traditional Algonquin territory. I acknowledge and appreciate Ottawa Public Health's continued efforts to promote reconciliation, which are featured in the annual report before you this evening. I would like to highlight some events that have taken place since we last met. In late February, following our board meeting, Acting Medical Officer of Health, Dr. Vera Etches, and Board of Health member Michael Kakish attended the Association Local Public Health Agency, ALPHA, winter meeting. I thank them both for attending this meeting on behalf of Ottawa Public Health and the Board of Health. I know Dr. Etches will be providing her verbal address to the board shortly on this item, and I will open the door before that to Councillor Kakish if he has any comments to provide. In March, I attended 2 open houses, which provided me with the opportunity to see details of the Hard Rock Casino's proposed $318 million expansion at Rideau Carleton Raceway. I'm pleased to have had the chance to review the proposed expansion plans and to consider health-related impacts this will have on our community. We know that problem gambling can have a significant impact on members of our community, and I will continue to monitor the casino expansion file very closely. Also last month, in collaboration with community partners, OPH launched the Your Minute Youth Video Campaign. The campaign invites youth from 14 to 18 years of age to film a 1-minute video to promote positive mental health and prevent or reduce harms related to substance abuse. If you know a 14 or 18-year-old in Ottawa, encourage them to take a minute, grab a camera or a phone, and start filming their minute. Video entries will be posted online, and the submissions deadline is April 20th. Last week, Ottawa Public Health received some positive news regarding the supervised injection services being offered at 179 Clarence Street. The Provincial Minister of Health and Long-Term Care wrote a letter to the Federal Minister of Health expressing support of OPH's application for an exemption under the Controlled Drug and Substance Abuse Act. This letter is a positive signal from the province, and I know the OPH team is actively working with the ministry on both operating and capital funding. Finally, I would like to congratulate the OPH team and the province for a successful promotion and implementation of a new Immunization Connect Ontario tool. This new online tool allows parents to update, view, and/or print their children's immunization records. I'm hearing very positive comments in the community about this tool and congratulate OPH on this success. We have a full agenda this evening, so I will stop here, and unless members of the board have any questions or comments on my presentation, I'll turn the floor over to Dr. Etches. But before I do that, first of all, my comments received? Received, thank you. And I'll turn the floor over to my colleague, Councillor Kakish, for any comments that he may have regarding the conference.
Sure, thank you, Chair, and perhaps Dr. Etches will talk a bit more about this in her verbal update as well. But with regards to the most recent Alpha meeting that we attended, some of the issues on our side, and they put the doctors in one room and the politicians and the other board members in the other room, but it's always certainly interesting to see that some of the concerns that we talk here are across the province, whether it's rural or urban, suburban municipalities. We see a lot of common themes, especially the issues that we've been talking about here in terms of opioids and cannabis, and a lot of the developments that are happening and changing quickly on that front, and certainly lots of concerns in terms of the questions that we still don't know in terms of enforcement and in terms of consumption locations with regards to public places. A lot of people at that conference were raising those concerns, and so if there's any kind of assurances is that we're all sort of in the same boat and share the same concerns. And the good thing about attending those conferences is that we could all speak with one voice, particularly with a provincial election coming up too, and certainly there was a focus on that in terms of leveraging that as an opportunity for local boards of health to raise those issues with one voice. And, you know, certainly pharmacare and tobacco as well came up as topics, and we got the usual update as well from the Provincial Medical Officer of Health, Dr. David Williams as well. So those are my brief remarks, and happy to take any questions if there are any, or if you'd like to permit that. Thank you.
Thank you very much, Member Kakish. Any questions or comments on Michael's presentation? Seeing none, thank you, and thank you for representing the Ottawa Public Board of Health out there at the big conference, and I thank you for your comments this evening. So turn the floor over to Dr. Etches for her verbal report. Doctor.
Thank you. Good evening. Bonsoir. I also have updates on local matters as well as provincial work that affects Ottawa Public Health. And before I get into that, I'd like to welcome Doug Kirkpatrick, who's sitting on the side. He is the Director of Communications and Community Engagement for Ottawa Public Health. Bienvenue. The Communications Knowledge Exchange and Municipal Relations Team and the OPH Board Secretariat and Support Unit have been brought together to form this newly named service area, Communications and Community Engagement. So we're pleased about that. The chair mentioned Ottawa Public Health's continued efforts to promote reconciliation with First Nations, Inuit, and Métis peoples. And in March on this topic, I joined other Ottawa Public Health staff at the Wabano Centre for Indigenous Health's, or Aboriginal Health's 2018 symposium. Le symposium était axé sur l'équité en matière de santé pour les enfants, les jeunes, et les familles autochtones. And I look forward to sharing more of this material with you as it will be reflected in a report on Ottawa Public Health's Reconciliation Action Plan at the next meeting. Also locally, influenza activity across Ottawa does appear to be winding down later than usual. The number of lab-confirmed cases in Ottawa has been gradually declining since early March. Les cas signalés de grippe au cours de la présente saison ont été plus nombreux qu'au cours des années précédentes. There are still ongoing influenza outbreaks right now, though, in long-term care homes and retirement homes. And so while the season is winding down, I encourage residents to continue to practice hand hygiene and stay home when you're not feeling well, especially if you're considering visiting somebody at higher risk for complications. Récemment, SPO a également commenté le plan d'action pluriannuel du ministère des Transports et du ministère du Tourisme, de la Culture et du Sport de l'Ontario, visant à faire progresser la mise en œuvre de Vélo Ontario, stratégie ontarienne de promotion du vélo. So this action plan for cycling in Ontario aims to create supportive environments for healthy living. It aligns with the Ontario Public Health Standards requirements related to chronic disease prevention and Ottawa Public Health strategic direction to inspire and support healthy eating and active living. Perhaps also of great interest, since our last meeting, there have been a number of budget-related updates. First, as you will read, or you have read, in this year's year-end operating status report on January 24th, the Ministry of Health and Long-Term Care announced $21,000 in base funding and $68,000 in one-time funding for the 100% provincially funded needle distribution and retrieval program that we operate. And then next, Ottawa Public Health provided our annual service plan and budget for 2018 to the Ministry of Health and Long-Term Care on March 1st. This plan is a new requirement of the ministry, and it's designed to communicate our program plans, our budget expenditures, and additional one-time and base funding requests. So Ottawa Public Health is now following this plan to deliver on our services in accordance with the new public health standards. Later on March 22nd, the ministry announced further one-time funding of $350,000 for the interim supervised injection site on Clarence Street, and $42,000 for amendments to the Immunization of School Pupils Act, $40,000 for minor capital renovations in the immunization clinic. More significant, last Friday, just April 13th, the Minister of Health and Long-Term Care wrote directly to medical officers of health across the province to announce a 2% base funding increase to all boards of health for the provision of public health programs and services. So Minister Yasik wrote that an additional 1% increment will be allocated based on local needs as identified in the Board of Health annual service plan submitted to the ministry in March. And I can assure you we did have additional needs that we put in. Nous sommes heureux de financement consenti à nos programmes et nos services, et je fournirai d'autres précisions quant aux impacts sur le budget de SPO dès que nous en aurons. In her letter to the medical officers of health, Minister Yasik highlighted the new requirement for boards of health to engage with local health integration networks in integrated health system planning, and I quote her, to include upstream interventions that will improve health, reduce health inequities, and assist in reorienting the health system. So on this topic, I'm pleased to share that last week, Chair Kadri and I signed the first Memorandum of Understanding, or MOU, to formalize engagement between our public health unit and the Champlain LHIN. The MOU outlines a common vision for Healthy Communities is intended to strengthen our existing collaboration and lays out key areas of joint work for 2018. Areas such as creating a structure and process for collaboration, population health assessment and joint planning for health, and health equity work. The subject of strengthening the public health sector in this time of increased expectations to contribute to the health care planning was discussed at the Association of Local Public Health Agencies meeting the chair mentioned I attended. And the subject of collaboration between public health units and the LHINs was a hot topic at the Ontario Public Health Convention in March. Having led a research project that examined the elements required for successful collaboration between LHINs and public health agencies, I chaired a plenary panel discussion about the research results, and it led to an exploration and expression of the risks and opportunities that this collaboration provides. Many of my OPH colleagues also made presentations at the Ontario Public Health Convention on their respective programs and services. And we were encouraged there and inspired to continue our innovative and evidence-based practices to promote and protect the health of our residents and people in Ottawa. So as we turn our attention to this evening's agenda, you'll see before you a report on cannabis. So we are continuing to prepare for the local impacts, working with our municipal partners. I just want to stress that this is an evolving file, and there are many moving parts that we'll continue to monitor closely. And looking ahead, Ottawa Public Health is pleased to be partnering with the City of Ottawa's Accessibility Office to co-host Accessibility Day in Ottawa on May 31st. SPO fournit des services et des programmes accessibles qui répondent aux besoins en matière d'accessibilité des personnes et reflètent les principes de dignité et d'indépendance. The Accessibility Day event here at City Hall will feature public health services with a focus on how they are delivered to the community in an accessible and inclusive way. We'll make more details available as that date approaches. And Mr. Chair, that concludes my verbal update. Merci. Je peux prendre des questions.
Thank you very much, Dr. Etches. Any questions or comments from the board members for Dr.? Seeing none, I just want to make two comments. First of all, I'm happy to hear about obviously the increase in funding that we found out last night. And number two is the fact that in terms of the agreement that we signed with Champlain Lynn a couple of days ago, again, is a good step forward in terms of working with our partners in Champlain Lynn. Because, looking at the provincial patients first strategy, I think that's a key piece for us to going forward with. So it's always good to start off with a good signed agreement and move forward with it. So thank you for that, Dr. Etches. Seeing no comments or questions, can we receive Dr. Etch's verbal report? Received. Thank you. Moving on to item number 4, public health approach to reducing harm from gambling in Ottawa. There is a presentation from Gillian Connolly, Manager of Healthy Communities, and then we will go into, after the presentation, into public delegations. We do have 3 public delegations this evening. And then after that, we will open the board up for questions with staff, as well as questions with the public delegations as they appear. All right? And so moving on, Gillian, the floor is yours. Thank you for joining us.
Good evening, Chair and members of the board. Since past spring, since OLG announced that Hard Rock Casino Ottawa would be selected as the service provider, Ottawa Public Health has been working with treatment providers, prevention agencies, as well as examine best practices, local data, literature, as well as how other jurisdictions are addressing and working to implement a public health approach to reducing harms from gambling. I'm here today, further to the report that's in front of you, to present Ottawa Public Health's 4-point plan that seeks to reduce harms from gambling. As a starting point in talking about gambling, it's acknowledged that some people gamble with no harms, while others do experience harm from gambling. Consequently, recent research shows that there is a continuum of gambling behaviors and corresponding harms, as presented in the slide. The gambling continuum is a spectrum, starting from no gambling to the most problematic form called disordered gambling. The important aspect is to note that as gambling behavior becomes more problematic, so does the severity of the health and social impacts, as well as the social and financial consequences. Problem gambling, which includes moderate risk and problem gambling disorder, is characterized by difficulties in limiting money and/or time on gambling, and that the person experiences health and social harms as a result of gambling. While we are concerned with those who fall within the problem gambling category, harms can occur across the continuum. Consequently, our 4-point plan seeks to address the gambling harms across the continuum of gambling involvement. In developing our proposed plan, we examined local data, which demonstrate that approximately 70% of adults gambled in Ottawa in some form. Approximately 35% of youth gambled for money in 2017. We also found that about 15,000 adults in Ottawa could be categorized as experiencing problems gambling. Unfortunately, only 540 individuals are actually receiving gambling addictions treatment in Ottawa. This suggests that there's a large portion of individuals needing treatment who are not seeking support. Research indicates that there are barriers that people face when dealing with gambling problems. These include a lack of awareness that gambling is a problem, lack of knowledge that help is available, and stigma and shame surrounded their problem. Additionally, due to this stigma and shame, people are not reaching out for help until they are facing serious consequences. In addition, our research found that people with problem gambling experience a range of harms, including shame, stigma, financial challenges, mental health issues like depression, anxiety, substance use, and increased risk of suicide. It also impacts people's families and marital relations, as well as work and academic performance. Research also indicates that with increased opportunities for gambling, may increase in problem gambling in the community. Overwhelmingly, what we heard from our partners was that there was a need for more prevention, to increase awareness of the problems of gambling, to increase people seeking treatment, as well as to decrease the shame and stigma. As such, our 4-point plan, which is evidence-based, includes input from our local prevention and treatment agencies, as well as OLG and Hard Rock, is a public health approach to gambling that will seek to help mitigate and prevent gambling-related harms for Ottawa residents. This plan includes establishing an Ottawa Gambling Harm Prevention Network. This is modeled after a number of jurisdictions, including a committee that currently exists at Laclimi. The network would include treatment agencies, prevention agencies, OLG, Hard Rock, credit counselors, local researchers. The goal would be to collaborate on work in implementing strategies and build capacity to reduce harms from gambling, not just at the casino, but across our city. Our second point would be to increase awareness about the harms related to gambling and early warning signs and improved informed decision-making about gambling, including the general population, youth, and parents. We'd also seek to work with community partners to reach to high-risk community groups, to work with community groups to reach high-risk groups and improve knowledge of local treatment options. And finally, we'd be looking to conduct ongoing monitoring surveillance related to problem gambling and harms related to gambling. To fund this 4-point plan, we are seeking that the board authorize the chair put forward a request to the province for one-time funding for $150,000 to support health promotion campaign, outreach to high-risk residents, and the establishment of the Ottawa Gambling Harm Prevention Network. We're also seeking for base funding of $200,000 to support ongoing work to reduce harms from gambling, which would include ongoing outreach to high-risk groups, youth prevention initiatives, monitoring surveillance, and ongoing support for the prevention network. In summary, OPH is recommending the approval of the 4-point plan, subject to funding, to authorize the chair to make a funding application to the Ontario Minister of Health and Long-Term Care, as well as to direct the report be forwarded to Council for their information. Thank you.
Thank you very much, Jillian, and we'll come back to Jillian's presentation with questions from the board after we hear from the public delegation. But before we go there, Councillor McKenney has a motion that she'd like to table. So, Councillor McKenney.
Thank you, Chair, for that. I have a motion that doesn't speak necessarily to the report. I recognize a lot of positive steps from Board of Health in terms of prevention around problem gambling, but in the 2013 report of the Board of Health, and one of the recommendations was, stated more explicitly the Board of Health's opposition to an expansion in gambling. So I'll just read out the motion that I have, but that's essentially what it speaks to. Whereas the increase of gambling opportunities in Ottawa will have negative health and social impacts on some individuals, their families, and the broader community. And whereas research shows that increases in gambling availability are associated with a growth in problem gambling. And whereas research shows that there is a near 2% prevalence of moderate risk in problem gambling in Ottawa, representing approximately 15,000 residents. And whereas, as we just heard, only approximately 541 individuals received gambling addiction treatment in Ottawa in 2016-17. And whereas the majority of researchers agree certain forms of gambling are more problematic, and these types of games include casino game tables and electronic gaming tables, i.e. slot machines. And whereas the most effective way to prevent problem gambling is to restrict the access and availability of gambling opportunities. And whereas the Board of Health on August 19th, 2013 approved Ottawa Public Health's position is against increasing access and availability of gambling in Ottawa. And whereas in November 2017, the City of Ottawa's Committee of Adjustment approved an increase in the maximum number of game tables allowed at the RCR site from 21 to 35. Whereas in February 2018, HRCO filed an application to allow a further increase in the number of game tables from 35 to 55, and gave notice that they plan to expand the number of electronic gaming tables beyond the current 1,250. And whereas the cumulative effects of approvals to increase to the access and availability of gambling are expected to cause significant gambling-related harms within the community. Therefore, be it resolved that the Ottawa Board of Health reiterate its ongoing strong position against increasing access to and availability of gambling in Ottawa.
Thank you very much, Member McKinney, and we'll come back to that motion after the rest of the process. So, moving forward, do have, like I said earlier, 3 public delegations, and the first public delegation to come and speak with us is Councillor Keith Aglai. Welcome, Councillor, and you have 5 minutes to address the board. Thank you for joining us this evening.
Thank you very much, Mr. Chair, and I understand that I can make delegation, but I can't ask questions, so if something comes up, I'm hoping people around the table can ask the questions for me. First of all, I want to thank staff for the report and the chair for the hard work that's gone into the report. I had an opportunity to meet with Dr. Etches last week and ask some questions and get some further information. And I also want to thank the people from Hard Rock as well, who've made the effort to come to the table, sit and talk with public health, so that's much appreciated as well. I'm going to start off with a little news report, and this is from the Ottawa Citizen a number of days ago, and I'm not going to read the whole story, but it says a 21-year-old Quebec woman was called for help at 5 a.m. Saturday because she'd lost all of her money at the Shoreline Casino, Thousand Islands, and wanted police to help her get home. Leeds OPP reported Monday. Police told her to stay put at the Gananoque Casino so they could make sure she was safe. But the woman called back to say someone had given her $20 and she was going to go back into the casino and no longer needed any help. It goes on to, with a statement from the police officer who indicated what was 911 worthy. And while gambling issues may not be 911 worthy for the OPS, you are dealing with people who are in an emergency of sorts, emergency for themselves, for their families, for their coworkers perhaps, and their friends. And for those purposes, what I would suggest to you is the people sitting around this table, you are 911. You are the people that can help. You are the people who can listen to what the problem is and come up with solutions to that. And in that regard, the four-point plan, which is up on the screen there, I think is a good one. But I believe it's only part of the puzzle. The original 2013 plan, or report rather, that Councillor McKenney referred to, the city put forward a number of recommendations, which I believe are still relevant and shouldn't be put off to the side. Now, in discussions that I had with Dr. Etches last week, she assured me that that was not the intent of the report, and there will be continued discussions around those original recommendations that came forward in 2013, and work will still proceed to incorporate those or to make those part of our ongoing strategy. So I appreciate that. And I also understand from those discussions with Dr. Etches that when the report references Hard Rock and says it could be a part of the proposed network, really what that means is they will be a part of the proposed network. So I think that's also an excellent step. What I would like to see, however, is I would like to see OPH become part of the landscape of the new facility, and I'm not sure how that works, and I'll leave that to the professionals. But what I'm thinking about in that is that there's a presence there, whether that's a booth, staff, materials available, a helpline, something, so that in addition to the casino being there, that, going back to my earlier reference, there's that impact or that effect of having a 9/11 there, that there's someone that can be reached out to, that people are readily aware of where they can go and what they can do. The part of the report that really concerns me, however, is the monetary ask of the province. And I think we have to look at that in context. So we know from the report that the province receives $2 billion in net profits every year from gambling. And a $200,000 ask on a $2 billion profit is 0.01% of the total amount of money the province brings in for the second largest city in the province that is going to have not one, as it currently has, one large casino, one smaller one, but it's going to have two large facilities, as well as all the other types of gambling that are out there, whether it's online or what have you. So on that metric, it seems to me to be quite low. If we take the 15,000 problem gamblers that the report points to, and you divide that into the $200,000, that leaves you with about $13 a year per person. Again, I find that to be a very disturbing metric to work with. And then if you look at what does $200,000 buy you in terms of staff, and again, I'm assuming that the staff will be engaging, will be staff with medical or psychological training that can work in this milieu. So you're looking at maybe 1.5 FTEs going forward. So when you look at those three sets of metrics, that's the part that really bothers me. I don't think that we're asking for enough money. I can't do anything about that tonight. But what I would ask, if I can just sum up, what I would ask is to the board is you can ask the questions, you're going to have the vote. The vote that you take tonight is going to carry a great deal of weight in the council debate. So I would ask you, ask the questions so that you can be sure that $200,000 is going to do the job. If you have any doubt whatsoever that the $200,000 is not enough money, tonight's the night to say that and the night to deal with that. Thank you.
Thank you very much, Councillor Eglai, and I'll come back to you, Councillor Fleury. So there are questions of you, Councillor Aguilar, so we'll turn the floor over to Councillor Fleury for the first question.
Thank you, Keith, for that. So 200, you made your point around the 200,000. What in your mind would be the right amount, or what amount should we be asking for?
Well, that's an excellent question. I know when this was earlier discussed last term, I believe the number that was being batted around at that point was in the order of $500,000. So $500,000, I believe, was the number that was being discussed at that point in time. That was a number of years ago. So inflation, a different facility coming to town, a bigger facility, whether that's the amount or it should be something more than that, I can't say for certain, Councillor Fleury, but certainly I think that's a good starting point.
And just to be clear, the 500,000 came from OPH staff at the time?
Again, I think it may have been, I think it was an ask of or would have been an ask of the province or some combination thereof. There may have been some OPH dollars in it as well. But again, I think the landscape has changed somewhat. We're having a much bigger facility coming in. And I think that's, you know, to the point made by Councillor McKenney, that I believe could create additional people who fall into that continuum of difficulty.
Before you go on, Member Fleury, I'm just going to give Dr. Etches an opportunity to clarify some of those comments. Dr. Etches.
Okay, so I'll speak to the question of the 500,000, the 200,000. If in 2013, the 500,000 was for a different plan. It included support to treatment agencies. So that is about the 15,000 people that we think may need more support than they're getting. That was a request that was coming from our treatment partners, and that was built into the ask in 2013. The ask before you today is for the 4-point plan, which does not include treatment dollars. We went back out to our treatment partners, and they are managing right now. There are not long wait lists. And so what this plan aims to do is to better make the connections, to identify people who need support, help them realize they need support, and then with the work, we hope that more people will seek treatment. That's one of the goals. With surveillance and monitoring in place, we'll be able to then say what more may be needed in investment in the treatment sector. But that would be LIN-funded agencies through the Champlain Local Health Integration Network. This isn't part of this plan. And so we're not trying to spread out the money to serve 15,000 people in treatment. Does that provide more clarity? Other questions?
I'll pursue it. I'll pursue it in the context of the debate. Thanks.
Dr. Kapoor.
Thank you, Councillor, for your input and your suggestions and thoughts. It struck me when I was reading this, and it was reinforced by your comments, that we're only looking at the province to provide funding as for what from their share of the profits that are coming out of this increase in gaming in Ottawa. And I was wondering, it seems to me a bit surprising that we haven't looked at, especially if we're talking about the expansion at the raceway, why we aren't looking at the provider. If you were commenting on having specific location-based resources that were dedicated to one location, it would seem to me fitting that the provider of that increased gaming access should be asked to play a role. I'd appreciate hearing your comments on that.
Yeah, I know there's a bit of conundrum around that because you would be taking money from a source that is, to your mind, is creating the problem or is facilitating the problem. But again, my understanding, and I've met with Hard Rock, and I know that they've met with Dr. Etches and her team, is that, you know, they are willing to come to the table. We haven't always had that experience with this industry. They're willing to come to the table. They're willing to be part of the solution. So I don't see why that couldn't be part of the discussion as well. If more funds were necessary or different programs became apparent that they were needed, that there couldn't be more than one funding partner. You'd have to work at, of course, making sure that there was some independence, obviously, for the board, even though the money was coming from a particular source. The board would have to be able to do what they do and do it with the best of professional ethics and practices. But again, I don't think that's insurmountable.
Anybody else? Any other? Sorry.
A follow-up. As I understood the proposal, the service provider is going to be part of the health prevention, harm prevention network. So do you have concerns about them being part of the network?
No, not at all. Not at all.
Because it would seem to me that it would be the same. If they're going to be part of the network, then whether they provide some of the funding.
Sorry, I should have been clear. In that answer, I was almost trying to put myself in the shoes of Dr. Etches and her team, being the medical professionals that they are, in terms of whether they're comfortable with that arrangement, I guess, where I'm going. But yes, they are going to be part of it, and I think it's a good thing that they're going to be part of it. And you're quite right, that may be a logical extension of that partnership, if you will.
Dr. Etches, did you want to add anything? No? All right, thanks very much. Any other comments or questions for Councillor Eglai? Seeing none, thank you very much for coming in this evening to present to us. Appreciate your effort. Moving on to representative number 2, Paul Palazzeri, the Executive Director for Social Responsibility for Ontario Lottery and Gaming. Mr. Palazzeri, you have welcome, and you have 5 minutes to address the board.
Just being loaded up. I'm sorry, thank you very much. Is that better? So thank you for inviting me to be here. I've got my clock out here to make sure I stick to 5 minutes. I just want to provide the context for the oversight for problem gambling within the context of OLG's modernization program and Hard Rock's engagement at the Ottawa Casino. So I'm just going to talk briefly about what is in place, the work that we have done for our responsible gambling program, and the engagement that we've had with public health to date. This one, sorry, thank you. So just and I've got a PowerPoint here. There's a little bit more detail in the PowerPoint that I'm probably going to be able to get to in 5 minutes, but I've done that intentionally, so there's a document for you to look at and refer to, and happy to answer any questions after this meeting. Just the context for what we do. OLG, as the Crown responsible for delivering gambling in Ontario, has a mandate not only to raise funds for the province of Ontario through gambling operations, but also to address problem gambling. We have a prevention and a mitigation mandate, and we've been building a program for about 12 years that deals with supporting players both on the prevention side and on mitigating for those who have concerns. And the example that Councillor Eglai raised about someone who's in distress at a casino, we take that very seriously, and I'll talk about some of the initiatives that we have in place to support people of that kind. Important to point out that I'm going to talk about prevention and mitigation, the different roles that we're playing. We are very supportive of the report and the proposals from Ottawa Public Health, and not only is it an approach that will work well with the program that we have in place, it is consistent with the trends and direction of independent academic research and public health programming across jurisdictions. Just some details on our program. Ontario has the best funded responsible gambling and problem gambling programming in North America. $38 million every year goes to the Ministry of Health to pay for independent research, to pay for clinical services such as those that you have in your region, and along with other prevention efforts. The program that I run is $19 million a year, and we are integrated across all of our lines of business. We collaborate with leading organizations in this space, and they help us co-deliver and co-develop our programming. The contract that Hard Rock has signed includes a number of pages of details and requirements of what they have to do related to responsible gambling. This program adheres to 3 different standards. There's a regulatory standard from the Alcohol and Gaming Commission. We are subject to 2 third-party standards, including the most rigorous standard for responsible gambling called RG Check, and that's around the world. It is the most rigorous standard. The Hard Rock facility and all facilities in Ontario have to adhere to this, and we work with all the agencies that I've listed and a number of others that aren't on the slide to co-develop and co-design the program, including all of our staff. All the staff at the site are trained by the Center for Addiction and Mental Health. in responding to red flag guidelines that players may demonstrate. Someone cannot diagnose, a layperson cannot diagnose a gambling problem, but we have strict protocols in place for intervening with people who are showing signs of distress. I'm not going to go through all these details, but our program involves training, it involves culture building, it involves direct player education within the gaming environment and outside of the gaming environment, voluntary self-exclusion, and increasingly technology and data analytics are helping us understand risks and giving us the ability to intervene directly with people. An important point of overlap between the approach that public health is proposing here and our approach is that prevention and mitigation is based on risk segmentation. So people of the kind that Councillor Eglai referenced who are in distress are at the right-hand side of this continuum, people who are in distress. But if you're going to effectively prevent problems, you need to understand what to do for players, different kinds of players, at different stages of their involvement with gambling. Our program is premised on this. This approach has been designed with CAMH and with the Responsible Gambling Council of Canada, one of the world's leading organizations in problem gambling prevention. Councillor Eglai asked about the possibility of resources being available at the casino to deal with people in distress. This centre will be there. This is what we call the PlaySmart Centre. It is run by the Responsible Gambling Council of Canada, an independent prevention specialist organization. They are there to help people and to deal with people, including those who are in distress. Across the province, 300,000 people go through these centres because we have these in all the casinos and in charitable bingo halls. The vast majority of those are just education opportunities. For about 4,000 or 5,000 across the province, they deal with people who are in distress. Technology, we're building time and money limit tools right into slot machines. This will be live at Hard Rock in September. And this is a leading initiative around the world. And we're also getting more deeply into data analytics so we can understand risk ratings for individual players and support them on that basis. So that's my quick 5-minute run through, and I'm happy to take questions. Thank you.
Thank you very much for your presentation. Questions or comments? Councillor Fleury.
Yes, thank you. You're obviously in the business of gambling, and it's your world, and I can appreciate what you're presenting. Could you speak maybe to the statistics that we have here in Ottawa? We're presented with 15,000 folks, 500 of which are receiving treatment. I find that I'd love to know how the statistics develop, because to me, is it based on OLG gambling component where, I know that you'd love to be like the LCBO where you have full monopoly, but we know full well that the online gambling world is the far west in many cases. So I'd love to hear from you as to the statistical component that are presented. I don't know if you worked in partnership with OPH to identify that number, but is it based on OLG gamblers, or is it based on any gamblers that live in our region?
Yeah. Thank you for the question, Councillor. I'll give you a bit of a background on prevalence rates and who's included in those rates and how those numbers are calculated. So problem gambling prevalence rates among adult populations are between 1% and 2%. So these studies are done every few years, and they're based on broad population surveys. And the data in Ontario and in the Ottawa region is consistent with the trends seen in other parts of the world. So it's between 1% and 2% are moderate and severe problem gamblers. That number includes people who gamble on forms of gambling beyond what OLG offers. It does include people who are online, doing sports bets, going to illegal gambling operations not offered by us. In the Ottawa area, it would probably include people who may be crossing the border to go to Quebec facilities and playing VLTs. But it is a broad number, yes.
So it would include?
It does, yes.
But those would be self-identified, like, university person gambling on the NHL playoffs right now. How do you, if they have no money at the end, and how do you identify them? I guess that's my question is, unless they self-identify or they're on blogs or they've reached out for help, how would you know that they've, because in a lot of cases you might think of it as a mental health or addiction component, but the reality is beyond that, it's a financial one. So how do you, I'm curious to see if the data that you're providing is specifically from an addiction standpoint, or the other one is from a financial impact standpoint that I'm interested in.
So if I could just clarify your question so that I understand it.
Sure.
Are you asking me how do OLG or our service provider staff identify someone who may have an issue, or are you asking about the broad population and the prevalence studies as they apply to them?
Yeah, combination of both. Like that 15,000 number, is it based on self-identified individuals? And if it is, then where does it leave that person that's left all of their money on the table on online gambling?
Yeah.
And, you know, and which to me are a sort, like they're the source of the same challenge here.
So I'll answer both parts of that. So in terms of the 15,000 people that have been identified here in the Ottawa region, when the surveys are done to determine the prevalence rate of problem gamblers within a population, they're based on a screen called the Problem Gambling Severity Index. It's a screen that's similar to other diagnostic tools to determine someone's level of harm in a certain activity. So the survey is administered to thousands of people, and people respond. So it's all self-report. Individuals will say what their activities are, and the screens look at the harm of gambling, which include physical health, mental health, time, ways it's affecting your relationship. All those factors are in the screen. So that number comes from the people who respond to those questions in that way. That's how you get the 15,000. So there's a number, 1 to 2%, then they calculate on the basis of who's in the Ottawa area. That's where the 15,000 comes from. So to answer your question though about, and I might be going beyond what you asked, but hopefully it's helpful. How do we know if someone is a problem gambler? Well, currently, if you're at the casino, we can't diagnose a gambling problem. It's different from someone at a bar who might be intoxicated with alcohol. A layperson actually can determine someone's intoxication level. It's not the same with a gambling problem. But what we've developed with CAMH are red flag signs. We can see that you've come to the casino more frequently. We can see that you're looking fatigued. We can see that you're making certain kinds of comments. And so our protocols for supporting people in those situations are very particular to what is presented. Currently, that's the way we can understand someone's risk factors. As we move into using risk algorithms, we can use player data from cards to understand low, medium, high risk and apply the same principles for interventions in the same way. We do this with our online offering, playolg.ca, and it was a leading offering in the internet space. We're going to be doing the same kind of things in the casino environment. And it's a more precise way for us to say, we see that your risk rating has gone up, and have a staff person intervene with you to give you the supports that you need.
Maybe finally, I think this is important information. How would you do the capture of this algorithm or this, this red flag component? How do you refer to an external and internal use? So if I buy X amount of lottery tickets, or if I go on your OLG.ca website and I spend that much money, and then the same week I show up at a casino in Ontario, are those three components linked?
So we can track someone's play patterns where there is what we call account-based play. So if you're online, we can see your account. If you're at the Hard Rock Casino in the future, we will see your account play. We will be able to correlate those things. Lottery is an anonymous form of play to date. It might change over time, but when we see data, we're able to correlate it, and that's what we plan to do.
Thank you very much, Member Fleury. Member Chernyshenko, please.
Thank you. Thank you for coming here today. I'm interested in the question of self-exclusion. I've seen both written reports and television, can't remember if it was Fifth Estate or who it was, but various ones looking at the effectiveness in different jurisdictions of self-exclusion. And I paraphrase by saying the effectiveness seems to be limited, I guess, depending on the jurisdictions, either people choosing to sign up, or even the organization that runs or monitors that actually catching them, or perhaps even the willingness to catch and exclude the people. What's your experience with self-exclusion, and have you made, I suppose, continual improvement based on recent experience or research?
Yes, thanks for the question, Councillor. So self-exclusion, for those who don't know, it's a self-help program for people who want to take a break from gambling. So if I'm gambling and I'm concerned about how much I'm playing and I want to step away from it, I join the self-exclusion program. The most important thing to understand about self-exclusion is that it works, and this comes from behavioral psychologists. It works when the individual in the program makes the choice and the determination to use it as part of their path to healing. It works most effectively when people go and seek clinical services, and that's why we promote it that way. When self-exclusion sometimes gets discussed, it gets framed as a policing program. It is not a policing program. And the behavioral psychologists will tell you, if you frame it that way, it's not going to work. To support people, we do a number of things to support people who go into self-exclusion. We take them off of marketing lists. We offer to set up an appointment with a clinician in the region. We offer to do their self-exclusion registration in a clinical office so that you don't have to go to the casino to sign up for it. When you sign up for self-exclusion, we offer independent people to be in touch with you during your period of recovery. And we also...
Ice is falling.
I'm glad it's not just Toronto that's having this weather. The other thing that we do is if someone is detected at a site having breached their agreement to themselves and they've come back to the property while in the period of exclusion, if we detect them, we will remove them. And that is done as a way to support people so that they know that we will intervene with them if they do return. And so we do a number of things to detect people. But it's around these, so including facial recognition, including if you put your card in, an alert goes off, including, believe it or not, eyeballs. So the security officers at a property will know the people who self-excluded from their site. We catch 3,000 people a year attempting to exclude using all of those methods. But it's important to understand that that is a support. It is not the purpose of the program, because it only works, and it helps thousands of people every year. People get better from using self-exclusion, particularly when combined with clinical services.
Right, so the difference between, I suppose, voluntary versus policing, I suppose I could try and draw an alcohol parallel. You could say to the owner of a bar, please don't let me in, I've got a problem. But it's up to them, first of all, do they actually have the right to do that? And then again, if you say, I've changed my mind, that's something that interests me is when someone signs up for self-exclusion, it sounds like they can say, yeah, I'm fine now, I've changed my mind. And back to the question of policing, when they are under that period where they've asked for it, can you literally stop them and refuse them entry?
So if you're in self-exclusion and you come to the property, we remove you. And we have the ability to do that legally because the person has consented.
Can that person on the spot say, yeah, but I've changed my mind?
No.
Or I've sought treatment and I'm better now?
Yeah. No, they can't. So when you sign up for the program, you have a choice of the period of time, 6 months, 1 year, or what we call indefinite. And the reason we have those choices, originally when the program first started, there weren't choices. We put the choices in, again, working with the behavioral psychologist, because when you're trying to take control over your behavior, you directing the choices, that's a really important piece. And there isn't one kind of problem gamblers. Some people are quote-unquote truly pathological and should never come back. Right? Those people, we would, if they say that, we'd say, well, indefinite is probably for you. But for many people, they need to step out for a while, they'll recover, then they'll come back. But giving that choice into the person's hands is a critical part of them being able to recover.
And just one last question. How do you deal with the perception, I suppose, the reality of the fact that OLG is sort of in the business of offering gaming products to people while at the same time providing support services for problem gamblers, where there's an inherent conflict in that? Is there something within your organization, your actual structure that separates, creates some kind of a firewall, if you will, between those two conflicting mandates?
Sure. In my job, that is the single most frequently asked question I get, if you might not be surprised to hear that. And so I understand the view that you must be in the business of taking as much money from people, and therefore it's a contradiction. The reality is, and this is one thing I've learned in the 10 years that I've been doing this work, is that actually over the long term, people not getting into trouble is better both from a business perspective and from a public health or a client safety perspective, right? The business isn't better off if you're addicting people and burning them out. And so one of the things, so to answer your question, OLG, and I have included in my slides, we have a statutory, regulatory, government policy, and now a business strategy mandate to figure out how to integrate support for people with making money over the long term. And to give you an illustration of why long term we need to be really good at this, and people in the gaming business actually don't like seeing people get into trouble. They don't like seeing that person who's there too much because they know they're going to get hurt. They know they're not going to be able to come back, and their life's going to be, in trouble. And we're not going to see them as customers. So one of the things my team has done, we've actually modeled how much money do we lose from people who self-exclude? Because people who self-exclude tend to be regular, heavier players. And we've modeled, if we can intervene with them before they get into trouble, if we can understand what that pattern looks like using algorithms and say, we intervene with them to get them help before they burn out, that will be better for them, and if they can come back and be a customer again, that's better for the business. So that, in my view, is the next 5 to 10 years, the good companies in this space in the world are going to figure that out and figure out how to, I don't say balance, I say integrate supports for people with a viable business.
So you said last question, very last question. So you have a vested interest then in someone being a repeat visitor once a month over 30 years, then coming for a month and going bankrupt and maybe committing suicide, I suppose, if I were to take it to its absurd, or not even absurd, its actual extreme.
Yes. Simply put, that's right. And when you look at our mandate of make money and help people, we have to be able to do that. Just last point I'll make on that is, Hard Rock will be attracting people who are tourists coming from outside of the region. Hopefully that's part of what their proposition is, and it's a good one. But also there's a proportion of their players that are going to be local, right? And when you are a locals market, that's where this imperative to integrate the supports for people with the business becomes even more significant. It's not Vegas where people will go for a few days and then leave. We have to think about it as a different kind of market.
Right. Thank you. I still harbor many concerns, but I appreciate your responses. Thank you.
Thank you very much. And Member McKenney.
Thank you, Chair. My concern with tonight and the report that we have in front of us and what we're hearing is that, we'll walk away with a 4-point plan and feel good about ourselves, but in essence, we're going to continue to see the same number of people with moderate to high-risk gambling issues. We know who's the demographics that are mostly affected: seniors, youth, people in low economic circumstances, so our more vulnerable residents. So which is why I struggle with it, because if it's there, we want to cut down on some of the harm, but it's the irony that we're dealing with this and the smoking report on the same evening has not been lost on me. So I guess whenever we talk about the work that you're doing and the work that we're going to be looking at going forward, when I look at the report that we have in front of us, it says it's quite clear that while the prevalence of gambling overall in Ontario over 15 years has declined significantly, but the prevalence of moderate risk and problem gambling has not. So everything that's in place to date has not worked. Maybe it's worked for somebody here, but someone else fell into the same pit, if you will, that Councillor Eglai referred to in when he was speaking, and of course that was a situation where we had a call to 911, so it was newsworthy for that reason. But we know that happens on a daily basis, where people go in and come out without any of the money that they went in with. And so I just wonder what it is that you think we're going to be doing differently after today that we haven't been doing for the last 15 years, because the prevalence of moderate and high-risk gambling has not decreased.
So thank you for your question, Councillor. A couple of points of clarification there. In the report, when it says the prevalence of gambling, I believe that was dealing with sort of OLG forms of gambling, and I'm not sure that it included other forms of gambling. The growth of gambling in the last 15 years has come from sources that OLG does not control. Mm-hmm. So while those...
It's casino gambling, yes, I agree.
Yes, but that prevalence number, further to the question the other councillor asked, includes online bookmaking, which is gray market, other forms of online gambling, other forms of gambling that are not in our jurisdiction. So that's actually, the prevalence of that activity actually has gone up. So against those numbers, the prevalence rates of problems have actually stayed stable. That said, I'm not attempting to diminish your point about harm. What I would say that has changed actually, so while gambling is a form of activity that has harm, inherently, it always will. I'm not here to say that you're ever going to make it perfect. Mm-hmm. Similar with alcohol, similar with other kinds of substances, similar with driving cars. They're different activities, but there will always be people getting hurt and killed driving cars, right? So not disputing that at all. One of the things, though, that has changed and can change, there are supports that are available in Ontario and in the rest of Canada that weren't there 20 years ago. And those supports actually, while the numbers on the page might be the same, the harm that is experienced by those individuals in some cases is minimized and differentiated. The opportunities that we have over the next number of years, and even the academic researchers who will be critical of our industry will say, what has changed around the experiences of people in those categories, the availability of the kinds of supports that weren't there before make a contribution. Not saying you eliminate it, but they make a very important contribution. What we've seen, our online site, we have responsible gambling tools built right into the experience. We make people set a budget for the week. We have algorithms to show them what the risk is. We have a range of other tools to have them control their behavior. It makes a difference. It makes a difference. And while the people who are really going to get into trouble, those people are always going to exist, we need to be able to intervene with them effectively, more quickly, before the harm gets too bad. We're working on doing exactly those things, and we can get better at it. Online, we are seeing a lower rate of problem players on our site, and the amount of money that they're spending and losing is lower, right? So to say that this is never going to change, this is the space I work in, I've seen it over 10 years, how it can change. Not saying we're ever going to eliminate it. And to the point, I showed our graph with the risk segmentation, the continuum. If you look from a public health perspective, and this is why I support the direction that OPH is taking, people who are going to have the serious harm, they're going to experience it. We've got to reduce that where we can. If you can reduce harm in those other segments where there's a small amount of harm experienced by a greater proportion of the population, which is what our strategy is premised on, what do new players need? What do casual players need? What do people who are becoming more regular players need? And when you can use technology and algorithms to understand that, you try to reduce the harm that those people experience by a degree so that the overall aggregate harm is also reduced, which is why I think the approach being taken here is consistent with what we're trying to do and consistent with what researchers and other prevention experts in the world are trying to do.
So you do have research, you do have the metrics to show us that the prevalence of moderate and high-risk gambling has decreased?
So the prevalence studies in Ontario, Canada, and the rest of the world have been declining. So the peak in Ontario was 5.8%, which was moderate and severe in, I think, 2006. And over time, it's been declining. The last study actually was 2014 by Williams and Goldberg. It said 1.2% of the adult population had moderate and severe problems. Why is that happening? The literature and the psychologists say something called the adaptation theory, which is introduce a new form of gambling, a new form, not a new opportunity to gamble, but a new form. You'll see prevalence rates spike, and over time, that will decline. And there's a number of reasons why that happens. So that's a fact, and it's borne out by multi-jurisdictional surveys.
It's not what it says in our report. Sorry, it's just not what it says in our report in front of us, so
yeah,
I'll
so
have to go with
it
that.
says 2%.
Yeah.
Again, there are different studies that are done. I always say it's between 1% and 2%, right? Because you can find one study
But
that
it has not significantly decreased in 15 years, even though
has.
certain programs,
But
the numbers I have in front of me tell me that it hasn't in Ontario, so I guess I'll leave it at that. Just back on Councillor Fleury's line of questioning, if you could just go back to that in terms of the numbers. I find it a bit difficult to understand how you capture all gambling numbers, how you are capturing the online, and why you don't think that number is much higher than it is.
So just I'm going to just distinguish again. Prevalence rates, of the kinds we've been talking about, are not done by OLG. Those are done by independent researchers who survey the population to determine the prevalence rate of gambling problem. We don't do that. What we do see and understand are points of interactions with our players. So we don't diagnose a gambling problem. We don't say, we know you're a problem gambler. And again, we work with the researchers and they say you shouldn't try to do that because what you can tell from someone's play activity actually doesn't lead you to conclude they are a problem gambler. We can see signs of risk that suggest that they're problem gamblers. So that's an important distinction. So we can understand low, moderate, severe risk, and from that basis we can understand and gain insights into what our players are. So I just want to differentiate what we can see versus what prevalence data will tell you.
Okay. Okay, thank you.
Thank you. Anybody else? Anyone else? Member Tilley?
Thanks, Paul. Just very quickly, so again, outside of the gamblers or the moderate to severe problem gamblers, and you talk about those who self-exclude, what percentage of the modern or severe problem gamblers would you say are those who self-exclude? In other words, how many don't, would you estimate? You must have those stats.
So again, the prevalence rate, the moderate and severe, those are the entire population, and they're playing all kinds of forms of gambling, you know, many of which are ours, but some of which are not. So to say I can draw a direct line between the 15,000 people that have been identified in the Ottawa region versus our own, I mean, I think the Ottawa self-exclusion numbers are probably in the order of 1,000 to 1,500 of people in the Ottawa region are self-excluded. So that gives you perhaps a sense of that proportion against 15,000 rather. But I caution drawing a direct line because I don't think you need to study it more and understand more of the variables to be able to say what that is. Okay. But self-exclusion, again, it's just one step people can do. It's not even the only thing that they can do to try to address what their issues and harms are.
So it sounds like it may be a smaller percentage. Then for those who don't self-exclude, you talked about steps at the casinos and other places where you do identify, you get the sense of those who might be problem gamblers or moderate or severe. Mm-hmm. What steps are involved at your end then to intervene in those situations?
Sure.
Do you bar people?
So we can, on occasion. We will do it involuntarily, exclude them, and those are not huge numbers where that happens. But what does happen in those cases is someone will be showing problematic behavior, and they will usually do something that crosses some kind of line for us to sort of say, we are really concerned about your safety. If they say, I'm going to harm myself, they're out. We will absolutely exclude them. And if they threaten suicide, we have to call the police, as do all sort of agencies of this kind. For less severe, and it is important to understand that those are the extreme cases. Yeah. But if we see that our staff see that, or now Hard Rock staff see that you used to come in, once every 2 weeks, and now you're coming in 3 times a week, and you're, making certain kinds of comments, like my wife's going to really be at me because I just spent our rent money. Right? It's very specific, the things that we direct our staff to intervene on. And so what we'll do, depending on the severity of it, there'll be an escalation. So if it's like, this is looking like a significant situation, a more senior staff member will come over, discreetly try to encourage you to maybe step away from the gaming floor, let's go have a conversation. When we have the new PlaySmart Center, let's go to the PlaySmart Center. We can talk about your options. Those are the kinds of interventions that happen when we see the serious red flags. But there are many conversations that happen that are, again, on the lower end of the risk spectrum, but they're important ones. Because someone who takes a step to self-exclude, say, 3 months down the road, it may have started with a conversation with someone in the food and beverage area that, oh, how you doing? Is it still fun? Well, no, it's not. Well, okay. Well, you know that these things are available for you. And they don't necessarily act on it the next day, but 3 months later. So there's a lot of nuance in how we can help nudge people's behaviors, and the interactions are a very big part of it.
So is that something you track then, that if staff are encouraged to intervene in those situations, would you have for the different centers
tracking how many you had that month where somebody actually approached them. So it's beyond just recommending that you intervene, that you're actually tracking that your staff are intervening and seeing how many problem or severe cases you may be addressing?
We do precisely that. So again, what gets measured gets done, and so we train people on the red flags, and there are reports when staff interact with players. They record. Today, I dispelled a myth. Today, someone was fatigue impaired, and I took the protocol to deal with that. And we track all those data points across each property, so at the property level. We also track the interactions that happen in the centers, which again, it's an independent organization that runs that. We track all that data, and this is the kind of thing that can change. Like this didn't exist 10 years ago. Now we have this. Now we know that we're bridging more people to support services, and we can track sort of what happens to them. So that's a very important piece of what we do, and it's part of how OLG makes sure that Hard Rock does what they're directed to do by the province.
Okay, and again, I echo Councillor Chernyshenko's comments on it's sort of the conflict of interest in the bartender that cuts off somebody from drinking. It's going to cut into their profits. Also, it's the same with OLG, although I hear what you're saying about hoping for the long-term saving of that account, so to speak.
Along with the hard program requirements, and again, we have lots of culture building that we do. All employees have to sign a code of conduct that says, I will carry out all the stuff I'm supposed to. We have RG champions and teams at each site that do a variety of culture building things, because we're changing the culture of an industry, right? So that we're trying to build in the care, which didn't exist some other time ago. So you have to do all of these things. We've just launched something we call the Play Smart Pledges, which are going to be our commitments to players that are going to be in public places in the casino. So that players see they're supposed to do stuff, and our staff see that the players see that, so it's another reinforcement mechanism. And there's a number of other things that we do, but it's part of trying to build care into the business.
Okay, thank you.
Thank you very much, Member Tilley. And Member Kakish, please.
Thank you, Chair, and thanks, Paul, for the presentation and coming down from Toronto, I assume, based on your comment about the ice. My question was with regards to the 4-point plan and what role, if any, you had or you have. I assume you go to public boards across the province. So what role or where do you come in terms of contributing to what our OPH staff are doing? And what do you think of the particular 4-point plan that we have before us and how it sort of meshes up with the demographics that we have in the city of Ottawa? Or is that something that's pretty cookie cutter, or do you sort of tailor it? Would you tailor it to everyone? And just getting your thoughts on that and how we can tighten it up if there is anything more that can be done to the 4 points.
Thank you very much for the question. I didn't actually spend a lot of time talking about our engagement thus far and our support for it. I think this is exactly the kind of thing public health boards should be doing, and Ottawa isn't the only one. We're doing a very similar process in Toronto, and we're doing other municipalities we're doing similar things as well. What I think is progressive and I think going to have an impact with this approach is what we need to do is coordinate the services that are out there, work together, and we do already, but I think we take the point that actually we can do better in Ottawa in terms of OLG Hard Rock's engagement with your the 4 treatment providers you have here. We have a service called Off-Site Self-Exclusion, which I referenced. We right now will have people register for self-exclusion at the treatment facilities. We work with credit counselors as well, because the numbers sort of saying, well, not as many people are going to treatment services as might suggest, given what the population is. Well, many more people go to credit counselors, and OLG built a network of relationships with credit counselors. That's another group that I think we need to bring in. But to your point about what can we do for the region, what are the specific priorities of this public health board in terms of demographics? You're looking at elderly, you're looking at youth. What is your mandate, and where are you putting your resources to educate them? We can help with that, and promoting and raising awareness and trying to drive behavior. OLG is very invested in doing that, and part of the $20 million that is my budget includes outreach, and we are increasingly trying to coordinate and leverage the different roles, mandates, voices, and touch points with populations in a targeted way so that we can speak to some of the prevention side in the gaming environment. Public health and the other agencies can promote directly according to their touch points. But there hasn't been the coordination that I think you need, and that's a huge opportunity for us to do this. And if they want to do local research studies on particular demographics and how they're being affected, what can we contribute to this? We're going to be sharing our oversight data. Like OLG has to oversee Hard Rock, the interactions, and a number of other data points. We're going to be sharing that with public health, having them see that kind of data. As we get into analytics, where we have risk populations against the player base, we'll share that data with public health. Some of it we will make public, some of it we might just keep within the conversation if some of it has to be confidential, some of it might have to be. But this kind of sharing hasn't happened at a granular and local level, and that's why I think actually this is a really exciting opportunity, to be honest.
So what kind of information then do you have now? Do you have any off the top of your head in terms of the main trends for Ottawa gamblers and what the issues are in terms of age or other demographics? Do you have any specific stuff you can mention off the top of your head?
So OLG has not done a lot of analysis of problem gamblers against those other demographics. And again, part of the mandate, like CAMH and the other researchers, that's more of their mandate. We work with them on that. This is why we want to understand what is Ottawa Public Health's priorities and mandates. How can we use data particularly as we get into analytics, we can understand different risk profiles. How can we look at our player base and understand what we see against what your priorities are? We're not there yet, right? But that's what the opportunity is for us to engage and to really, move forward with. Part of the challenge in this space is what's success look like? Because lowering the prevalence rate is a really hard thing. From all the different interventions that happen, it's a really hard thing to do. We've studied it. We did something called a social responsibility return on investment, where we tried to monetize the investment dollars that we put into supporting people. And it was inconclusive. It's a very hard space to be in. But I think overall, if all the different players share research priorities, share approaches, share the data that they have, we're going to learn more in 5 to 10 years than we know now.
And I just want to clarify something, because this came up a couple of times. You're saying the number of people that are gambling in the casinos is down, but when you introduce or you include online gambling and different forms of gambling, it's gone up. Is that what you were saying earlier in the presentation? Yeah,
the casino business has sort of plateaued, and part of the reason that we're having, so that's true. But overall gambling across all forms, especially the ones that are gray market or illegal, that's where there's been more growth.
Can you clarify what you mean by gray market?
Sure.
So is that you don't have factual data on that? Or
no, it's not technically legal or regulated in Ontario. So all the online gambling offerings that you see advertised for their like Poker Stars and 888, they're not regulated by Ontario. Right, and so when people go play those, the standards that I've been talking about don't necessarily apply to those.
But OLG keeps an eye on them, or how do you?
We don't.
Okay,
it's outside of our purview.
Okay.
Online sportsbook, single sports wagering is not legal in Canada. People do it. It's a multi-billion-dollar business in Canada. They're just doing it outside of the standardized, regulated gambling market.
Okay, so
that's
these
where
are the
there's been growth.
self-surveys the self-stats that are being reported.
Yeah.
That's where you're getting your numbers. But in terms of casinos, it's steady, but I heard you say it went down earlier when you were responding.
Yeah.
But is it steady or is it going down?
Well, it depends on the year. It's actually growing. The revenue is growing sort of slightly each year. We want to grow the player base so that there are more moderate players coming. So the opportunity that Hard Rock is presenting is exactly the kind of thing that you want for a healthier gambling population, because it's not just what used to be called a slot box by a racetrack, where that's really what your opportunity is. There are restaurants, there's entertainment, there are other things to do there. And that you get in people who aren't just the hardcore gamblers, you get people who are more moderate, who are maybe going to go see a show and then spend $100 or a couple $100 playing. That is consistent with a sustainable business model where you have people who are playing, they're contributing, but it's not relying on just the hardcore gambler.
Yeah. So with regards to the Rideau Carleton Raceway, and again, I don't know if you have these numbers off the top of your head, but I think 2014 you said is the last stats or census that came out in terms of the numbers versus last one. Is that stabilized too, or is that down compared, relatively speaking, to the number of gamblers?
So you're talking about the prevalence of problem gamblers?
Yes.
Yeah. So that, again, looks at the entire population of gamblers doing things that are beyond OLGs. So I, off the top of my head, I don't know for the Ottawa region, the percentage of people who would be only slot players. I don't know that number. But the trend for problem gambling rates has been going down in Ontario and across the world.
For casinos?
For all forms.
For all forms?
Yeah.
Okay. Okay. Okay, thank you, Chair.
Thank you very much, Member Kakish. Member Taylor, please.
Thanks very much, Chair. So I just want to clarify, I know you just, for Member Kakish, you just clarified that you know, your gambling rates have plateaued in terms of casinos. But I'm looking at your, at the OLG's annual report from last year, which shows the change from 15-16 to 16-17 in revenues. And lottery's gone down, charitable gaming's gone down, resort casinos up 50 million, slots and casinos up 87, internet gaming up 9, so for a total revenue change of 29,592. So it looks to me like it's all going up. So is the revenue going up or the number of clients going up?
So revenue,
separate the
yeah.
two.
So again, now we're talking about different lines of business,
Right.
which is a key thing. So overall, OLG revenues are going up. Casino revenues have been going up modestly, not dramatically. The player base has not been growing significantly. It hasn't been declining dramatically, but it hasn't been. The casino player base has not been growing as significantly as other areas of business.
Okay, but when you say casino, because you report resort casinos and slots and casinos as two different line items. If I add those two different line items together, they are the single biggest, taken together, they are the single, they far exceed charitable gaming, they exceed the lottery gaming, they exceed internet gaming.
Yes, yeah.
Okay, all right. Another one of the documents that you've got out there, the business plan for 17-18, a lot of the discussion has been around internet gaming. And that's one of the questions, frankly, that I'm going to have for our staff, is how does our 4-point plan reach people who are only, as Councillor Fleury pointed out, gaming online? Your own document indicates that I think it's 72% of the people who are, an estimated 72% continue to exclusively play in the gray market. So not your sites or, you know, sites that are presumably kind of trackable or connected to avenues for assistance type of thing. And then it goes on to say that, you know, under our business plan, we really have to expand in that space, presumably to try and take some of that business away from the gray market, I'm assuming is what you're trying to do. But what guidance would you have for us as a health unit then, who's trying to tackle the problem of problem gambling, when one of the fastest growing areas is online gaming, and seemingly one of the fastest growing sectors is not yours, it's the gray market, and everyone's carrying these things around, and that's where they're doing their gaming. So how do we as a public health unit, you're trying to reach them as potential clients, we're trying to reach them as, you know, potentially people who might be affected by problem gambling. So how do we reach them? How are you trying to reach them?
So the approach, so my advice to the public health unit here, working within the constellation of players in Ontario trying to prevent and mitigate problem gambling, like any strategy, figure out who your most important, I'm not going to presume what the strategy should be and what the tactics should be, but we know how to do this, and we do it. You pick who your priority audiences are, you find the ways to communicate with them, and you invest in communicating with them to those channels. Now, a public health body is going to be limited in its resources, is going to need to work with partners like us. There are ways that we can communicate a bit better to internet players who are not on our site, but I don't want to exaggerate the ability for any of us to profoundly change the behavior of those people where we don't have the touch points. We know that players who are in our environments, the greatest ability we have to shape people is when we have those touch points with them, when we can integrate things into our sites. There are messages that you can do, there are things you can say to those other populations, but I think the Public Health Board and everybody else is going to have to decide who are the priority targets and audiences, and how do we best reach those people.
Okay, so I appreciate that. I mean, I guess where I'm going is, as if you're on an aggressive tack to try and acquire these individuals as customers, how do we ensure that, A, we get the benefit of your research as to how and where do we find them to go after them then as people who might be potentially problem gamblers, and as you acquire them as clients, because, I mean, presumably they've been gambling for some time, but, the original kind of gambling models in Ontario were not set up with responsible gaming in mind. Those were concepts that were brought in later along the way and had to be overlaid into an existing infrastructure. Whereas presumably with internet gambling, at least OLG's push into it being, not small. I don't want to minimize it, but it's a fraction of your business at this point in time.
Yep.
So as you grow that, how do we ensure that? At least for residents who are residing within Ottawa, and it's very difficult in an internet world, but how do we ensure that we're in there with you? Right? As you're trying to acquire them as a client, we're trying to inoculate them against problem gambling and make sure they know that we're here.
Yes. So what I can commit to is we will share our strategies and approaches for the different lines of business that we have, including internet. And I would also invite our colleagues from places like the Responsible Gambling Council, the Center for Addiction and Mental Health, along with your local agencies here, to have that discussion and decide what the priorities are and who can reach them in the best way.
Okay. Thank you very much. Thank you, Chair.
Thank you very much. Anyone else? Seeing none, thank you, Mr. Palazzari, for coming out this evening to present to us. And I know your day started early this morning in Toronto, but the weather played havoc with it. But thanks for making the effort to come out and meet with us. Thank you. Our next speaker, board members, is Catherine Bernatchez from YMCA YWCA. Welcome, Catherine, and you have 5 minutes to address the board.
Okay. Good evening, bonsoir. Thank you for having me. So my name is Catherine Bernatchez, and I've been the youth outreach worker in Ottawa for the YMCA Youth Gambling Awareness Program since 2011, and since September of 2017, I've been its provincial coordinator as well. So YGAP, so the Youth Gambling Awareness Program, is a local program only dedicated to youth problem gambling prevention. So it's a bilingual program, and we offer gambling awareness message and education for youth between the ages of 8 and 24. And we also offer awareness to parents, teachers, and adults involved in young people's lives. So we do that by offering info session, interactive educational workshop. We also participate in many community events, fairs to increase the awareness about youth gambling, and also about the awareness of the different services available, so the referrals. And we also do youth engagement project every year and community involvement project as well. So I am in support of OPH 4-point plan. I want to share a little bit more about my personal experience working with young people in the Ottawa area. So from what I see, there is a big lack of public awareness about just general gambling harm, and also specifically for young people and their prevalence rate for problem gambling. So what the stats are showing is not what I'm actually seeing in the community. So from when I'm talking to young people in Ottawa, it's closer to 80% of them that are actually participating in some gambling activity. So it can be just a bet that they do with a friend. A lot of them are wagering on sports as well, and all the new trends with technology and video games that are incorporating a lot of gambling elements. So there are gambling, so there's a lot of opportunity now for them to gamble. And also, just a general public awareness too. So I'm seeing a lot of resistance when I'm trying to go in schools, to talk to teacher, principals, to talk to young people about gambling. There is some resistance. So there's not as much awareness that it is important to talk about addiction related to gambling like it is to talk about addiction related to substance use and alcohol. So phys ed teachers are covering that, and yet they're not covering gambling. So most of the time when I'm offering the workshop, the students will say that I am the only person that's ever talked to them about responsible gambling messages. So no teacher, no parents, no other guest speakers have addressed gambling. And yet it is an activity that most of them have already participated in. And also, parents' role in the awareness. So a lot of kids are starting with their parents, teaching them how to play poker. A lot of them are buying them scratch tickets or wagering on sports with them. Yet they're not saying any responsible gambling messages when it comes to that. It's also, I think, important to address awareness of stigma related to problem gambling. So studies are showing that stigma is the most cited reason why people are not seeking the help that they need, and that disordered gambling is the 13th most stigmatized mental illness over 40 different ones. So definitely there's a big link between stigma and problem gambling. And part of our programming, we've been funded from the Gambling Research Exchange Ontario to develop a module addressing stigma and problem gambling to try to reduce the negative attitudes associated with people with problem gambling and to really seeking help when it comes to problem gambling. I also want to share my experience with the Ottawa Problem Gambling Coordinating Committee and Gatineau Ottawa Region Responsible Gambling Committee. So I've been part of those committees since 2011, and they've just been really great experience or opportunity to really share knowledge, information, and to collaborate together. So people from the prevention, the treatment, and also the industry to be able to just improve our services, the information that we can give to the population. Just to name a few examples, with that collaboration, that knowledge, I am able to, instead of just giving a phone number of where to call for help, I can send more personal message about, you can call Jane at Rita Wood. These are the type of services that she offers there. I'm also able to know that if you're worried about confidentiality, you can give her any name. That's the name she will write down on your file. So it just really helps to decrease the stigma, negative, and the fear of being judged, or that there might be some consequence if I'm seeking help around confidentiality. And other initiative that the Ottawa Gatineau Responsible Committee has done. So we identified there's been a lack in knowing all the different referral agencies. So instead of giving different brochure to clients which might come from Ontario or might come from Quebec, they've created one referral card with all the different treatment services available in Ottawa and Gatineau area. So just a simple card with all that information that fits in their wallet too. So it's really easy for them to share with other people, can be discreet as well. So just to share some initiative that this committee has done by really collaborating prevention, treatment, and also the industry to address the gap that we're seeing in addressing harm related to gambling. So in conclusion, I just believe that we need a more formal approach to addressing harm related to gambling and really sharing our resources together. Thank you for your time.
Thank you very much for coming in this evening to present. Any questions or comments? Councillor Taylor?
Thank you very much, Mr. Chair. And not really to you, Catherine, I'm sorry, more to our medical officer of health. So Catherine works with YMYWCA, looking at kind of the charter of the new gambling harm prevention network. Would an organization like hers fall into that gambling treatment and prevention service providers category?
That's correct.
Okay, and the one area where you kind of mentioned, you said, look, I'm the first person that has often talked to people, not a teacher, not a parent, those types of things. So either through membership or through outreach, I'm assuming that the new network would engage those types of people. parents, obviously, but could be teachers, could be the school boards, that type of thing?
Yes, absolutely. I think you see in the plan we have identified that a focus on youth is important. Collectively, we'll be looking at the most effective way, using all the data we have about the best strategies and an evidence-based approach. But typically, our approaches to reach youth are multi-pronged. So we work directly with youth, we work through youth who are engaging youth, we try to support parents and people who are involved in the lives of youth.
Okay. Thank you. Thank you very much.
Anyone else? Seeing none, Mr. Bernaches, I do have a question for you. Did Ottawa Public Health, during the consultation process, reach out to you for comments or consultation?
Yes, on many times. So lots of emails, phone calls, and also in-person meeting. And they've also went to the Lac Limay Casino and got more information also about the collaboration that we do with that committee. So, yes.
Thanks very much, and thanks again for coming out this evening to present.
Thank you.
To the board members, I'll turn the recommendation back to you, but before I do that, what I'd like to have Member McKinney put the motion to go beyond 7 o'clock. So Member McKinney, please.
You don't think we're going to finish in 10 minutes? All right. Motion to extend the meeting. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Is that carried? Thank you. And the first questioner is Member Fleury.
Thank you, Mr. Chair. I won't be long because I think we covered the subject at length. In my mind, there's a couple of elements that I happen to be uncomfortable. And, usually I speak very highly to the data that OPH presents. But in this case, I'm very weary as to the 15,000 number that we're putting out there, because I actually think that it's much bigger than that. And I think that beyond addictions and gambling problem, one of our responsibility is also financial health. And to me, financial health plays into the person's ability to be healthy and live an active life in Ottawa and so on. So, usually I endorse the report. I like the analysis. I generally like it here. I would caution us on leaving the 15,000 going forward, because I think it insinuates a firm number when those are estimates, I'm comfortable if we talk about what's captured, but also highlight the challenge in that data. But leaving it alone as 15,000, I think is I'm worried about it. I want to go back to my colleague's presentation earlier. It seems to me odd that I recognize that this is a 4-point plan. I recognize that there might have been a different need at the time for addictions treatment component. I think it's a bit risky to not ask for some of those dollars, because this is today's there might not be a long waiting list, but if the offering expands, there might be new pressures. And I would like to maybe take it offline with you, Vera, and pursue that conversation as to what would be an appropriate number to plan if this proposal goes forward. So I understand why you're bringing the numbers to the 4-point plan, but I don't think that it'd be fair to just drop the previous goals of 500,000 specifically because of the waiting list. So maybe staff at some point in time can speak to that component. And then finally, I think that it's a risky business, because this evening we're only looking at the government-managed gambling. And it's important to say this. This is not like alcohol, where alcohol, you have port entry points, they control it, the sale of alcohol is very controlled. So, there's a lot of elements that are more controlled that way. And it's important for us at Public Health to be aware that people go online, they hide their IP addresses, they buy gambling through UK, through Asian markets, through American markets, and then gamble their life away. And there's been very rich people that have lost their wealth with this online gambling. And this is not, if you have an opportunity, Google Jaromir Jagr, a known NHL player who lost $11 million on online gambling. So to me, there's additional risk than what's presented. We're in a tight we look at it from a tight perspective because of the application that's in front of us. I would ask that we get, following tonight's discussion, a more accurate funding ask, to better protect our community as part of this. And I would also caution us going forward as to having a true capture of the data relating to gambling. We might have good data relating to government gambling, but we have to be aware and cognizant of anything that's non-government regulated.
Thank you very much. Staff, did you want to comment, or Dr. Hedges?
I can start, and Jillian will probably have more to add. So yeah, the 15,000 figure is probably worth using other numbers and not dwelling on that, because it is an estimate from self-reported surveys, and we know self-reports are often underestimating the real magnitude of the challenge. That number, in the definition of moderate to problem gambling, Cam, I'm just looking to see, I think it does ask about financial aspects. So there is an element of looking at the financial impact on people in that estimate. Having better data is part of this four-point plan. I mean, that's why we put surveillance and monitoring as a core piece. So I would agree with you that we need to continue to go forward and study it more precisely in Ottawa. On the comment that tonight we're only considering only considering government-run gambling, that's not the case. So this is a general strategy to tackle gambling in Ottawa, which is any kind of gambling. And so when we're reaching out to high-risk groups, when we're talking to youth, when we're working on overall messaging, it would include all types of gambling, all different venues, legal, illegal. And I think that's part of what's needed when we look at awareness. People were speaking to it. People aren't always aware of the different harms that may be there, or protections that could be there, systems to flag problems. So, and then the comment about looking at investing more money in the treatment sector is an interesting one. I'd be very happy to talk with you more about that. As I mentioned earlier, that funding would come through the Champlain-Lynn to the treatment agencies. So that would be another partner we'd want to engage in the conversation about what's needed. We did press our partners on this. We talked to them several times about what they're seeing the current need is, and they did not come forward with a particular ask for more treatment money at this point, but we can continue the conversation. They all agreed that investment in prevention is important. And I think for the record, I don't want to correct something, because the $500,000 was out there. In 2013, it was actually $2 million that was requested for treatment, and that didn't come through. Jillian, did you want to add anything? No.
Thank you very much. Member Kakish, please.
Thank you, Chair. And I just want to get clarification a bit on that too, because you mentioned that you did speak to the treatment side, and that was a big part in the discrepancy in the number. And so if you can talk a bit about that. I'm not entirely clear on who the 4 agencies are that provide those services. What do they do? And can you tell us a bit more about why they don't need those? Because I'm not sure why we would take this offline and discuss it again if you've already had those discussions with the treatment side aspect of it, and why would we would be changing the number if the circumstances are not what they were back then.
Thank you for the question. There's a few questions in there. So first, the 4 treatment agencies is Redawood, Amethyst, Centertown, and Sandy Hill. And they provide various types of treatment from individual to group to family agencies. We did discuss with all of them. We've been doing consultations with them over the last year or two. When we discussed with them back in 2013, and then we did another consultation 2017, we were finding a lot of the same information, and overwhelmingly what they said was that there's more prevention was needed. And so I think when we looked at 2013, we indicated that had we gone forward, to be very honest, had we gone forward, had the recommendations been approved, all of the recommendations been approved in 2013, had we been able to do the prevention, then we had anticipated that there would be needed for more treatment. I think where we're at right now is we're looking at doing a phased approach, as Vera's talked about. We've had a lot of discussions about data here, and I think a lot of the data, what we've kind of seen is the data of the 15,000 is based on a prevalence rate, based on Ontario data. We're still needing to get a better understanding of what's here. I think when we go back to our treatment agencies, as Vera noted, they don't have a waiting list. And so when we're putting forward that estimate in 2013, it was based on estimates, based on what we had back then. Right now, we are still estimating, but we're still not sure how many that actually looks like fully in Ottawa. And so I think if we were looking at potentially a phased approach, we're looking at getting a really better data and understanding everything here. And that's what our treatment agencies came back and said, that overwhelmingly that people are coming to them when they're really at the end, and that they're really looking to see how we can be doing more work up front.
Thanks for the clarification. I think, and that's important to know, if you've been talking to them for the past year, that's we're not rushing anything. We've been in discussions with them, so I wouldn't see any reason why we would, set this aside and delay or have more discussions on it if staff have been consulting with those 4 treatment centers. And the other thing we see with the province, and unfortunately, this seems to be a regular occurrence where we ask for one-off fundings here and there. That seems to work well, and within reasonable requests, usually they have given us, whether it's the opioids or the various other funding requests that have come from us in the past, or with the Syrian newcomers as well a couple of years ago. So this seems to be well thought out and well consulted in terms of our stakeholders. So I don't see why there would be any reason to take the discussion offline and waste more time on it when we've been talking to them for a year and a half. Thank you, Chair.
Thank you very much, Member Kakish. Member Taylor, please.
Thanks very much, Mr. Chair. So I'm kind of falling halfway between Councillor Fleury and Councillor Kakish here. So I support the report and the recommendations in it. I have concerns, just like Councillor Eagle did, about the amount of money that we're asking for. And I'm wondering, and I'm going to continue my remarks, but just putting it out there for thought, and I'll try and read your faces as I continue talking. But I'm wondering if we couldn't perhaps open the door to having the kind of discussion that Councillor Fleury wants to have between staff and councillors and board members without stopping the process, as Councillor Kakish is worried if we say, no, this isn't what we want to come back again to the board, by simply saying that we would seek a minimum of $150,000 and a minimum of an ongoing $200,000. That leaves us the latitude and leaves staff the latitude to, with the chair and with members who want to participate in that discussion, evolve this and perhaps not even need to bring it back to the board in the future if we want to change that number. I also think it allows us to acknowledge quite clearly to the ministry in the ask that we are not operating with all the data that we'd like to have. We can say that from the data that we have right now, this would be the minimum starting point that we would want to begin from. But as we get better data and become more informed, rest assured that ask will go up. But it's putting them on notice now that that will happen. So I leave that for your consideration while I tackle one of the other items. That was, of the 3 presenters, that was Councillor Aguilar's concern at the 4, was perhaps we're not asking for enough money. A lot of the discussion with Mr. Pellizzari and I apologize, I can't get Catherine's last name, but discussed about online gambling. Online gambling, sports betting, all of the stuff that was not taking place in a land-based facility. And even according to the OLG's business plan, that seems to be the growth market. That's where they're targeting their growth. They see that 72% gray market out there, and they want to take a bite out of it. So it's a little bit of the Kansas City shuffle that we're all looking over here at the Hard Rock, when the real problem in gambling is not really going to be land-based facilities. That's not where the escalation is going to come from. It's going to come from people who never leave their house, and they're sitting down in front of their computer. I don't know where that NHL player lost his $11 million, but he probably didn't lose it all in one night at a casino, right? He probably lost it maybe on sports betting, who knows? So, you know, I'm interested in how our staff are going to tackle that. And I know, you know, Mr. Pellizzaro said, look, we'll share our intel with you, you know, from an OLG perspective, but clearly they can't reach all these people. If they could, they'd be customers of theirs right now. So I don't know how we propose to reach them. Now, I think we're a little bit better positioned than perhaps they are, because OPH actually has a pretty healthy track record of going after people who are, you know, in an addiction situation, perhaps practicing what is illegal activity, you know, as illegal online gamers might be doing. So we have a good track record of finding people who are doing things that are harmful to themselves in, you know, in a context that's not strictly legal, and being able to touch them, and they're not fearful of that. And I look at the work that we've done in harm reduction and say that's a great example of that. So I'd love to hear, Jillian, if you have thoughts on, and then I'll circle back to my first point. I'd love to hear any thoughts you might have on how we're going to reach people online gaming, youth who are using their iPhones and whatnot to do sports betting, and perhaps don't even think of themselves as gamblers.
I like the question and appreciate it. And I think one of the things that we were trying to get through that might not have gotten through the report was that although the expansion was a piece of the puzzle that really started us kind of kicking this off, what we looked at and found was that this was gambling in the city was so much bigger than that. And that's actually why we're bringing the 4-point plan forward. And online gambling is something that consistently came up. Catherine's actually a great person to be talking to about how to reach youth with online gambling, because what we're seeing is overwhelmingly more youth are gambling online, and then the problems with gambling, the youth who have what would be characterized as problem gambling is also a concern of ours. And one of the things is the gamification of games online, and really kids might not even be, Catherine was sharing this with us, was kids might not even be acknowledging or aware of that. So Catherine actually would be one of the biggest pieces of the puzzle and her work to try to get more youth to be aware. So one of the things that she shared with you is getting into the schools more, getting conversations out to parents. That's what we'd be looking from the youth perspective. I think from the, you know, if you're looking for 18 to over 35s, is really looking at those sites where people would be getting some of that information and putting some of that data in there. An example that I could be providing for you where we've reached people online with messages that would be kind of unconventional often, that people might think is our health promotion messaging that we provide on Grindr for like sexual transmitted diseases. And so we're looking at how can we be leveraging some of our successes that we've had with reaching people online. We actually, from a public health unit, we actually do really well with this, you know, from reaching out, acknowledging, just as Paul had said, like, who are their priority populations, what are the targets channels, and we have some successes with that in the past. And so we acknowledge that online gambling is probably one of the biggest pieces of the puzzle that we'll need to be doing. And why we're looking at the plan and the network would actually also include a local researcher who we've connected with here, who's actually part of the GRIO, it's the Ontario Research Group, and looking at how he can be working with us as well as OLG to kind of be looking at some successes that they find from their research to reaching out to those people who are in that gray world.
Okay, so that's good. Thank you. I appreciate that, and I think that speaks well of the work that you're planning to put in on it, and calms me a little bit about that piece of the puzzle. I don't want to let Mr. Pelizzaro off the hook completely. I think one of the things we should press OLG on is I must believe that they have a very, very complex model which helps them demographically isolate who their target customer is, particularly if they're pushing into the online gaming segment. So I would urge the staff to urge OLG to share that with us. They will undoubtedly tell you it's proprietary information because that's how they acquire their customers. But I'm sure we can, cover that hill off with some kind of NDA or something. But if they can tell us who they're targeting as those online gaming clients, is it the male 25 to 30 from this socioeconomic background, those kinds of details, that will help us target our outreach as well. So having said that, Mr. Chair, I come back to my first point, and at the risk of the Board of Health not being bold, which we don't have a record of not being, I'd like to put it before committee, and I'm happy to write it up as a motion, that we amend the report to simply take the set amount of the 150 and 200K and replace it with the words a minimum of 150 and a minimum of 200K. And I'm happy to write that up as a motion, or you can simply put it to a vote at your will.
Thank you very much, Member Taylor. And so just on that comment from Member Taylor, do you want Member Taylor to put a motion forward, or are we okay with passing that recommendation on to staff as suggested? Leave it up into the board's hands.
I think it has to, because it amends the report, that we actually, I don't know if I put it in the speed, but I think we actually have to pass it.
Legal?
Yes.
Omar?
Procedurally, my advice would be to have a motion in writing.
Thank you very much, Member Taylor, and we'll come back to that after if anybody else has any questions or comments. Member McKinney.
Thank you, Chair. I just want to confirm or dispel a few things that have been said tonight. And just as I'm looking at the report, there's been a lot of discussion around, what is the problem that we're looking at here? Is it land-based gambling, or is it some sort of gambling either by phone in a dark basement somewhere where nobody knows what is happening? And while I can appreciate the concern for all types, and we do hear those stories of people who have lost their life savings and in their dark basements. If I look at the report, it does say here, and I just want to confirm with public health that I'm understanding, on page 10, the majority of researchers agree that certain forms of gambling are more problematic. Games that involve the illusion of skill or the experience of almost winning are more likely to be associated with gambling problems. These types of games include casino table games and EGMs such as slot machines. And then if I look back on page 9, in Ottawa, the 4 most common modalities of gambling for those over 18 years of age and who have gambled more than 5 times in the past year were lottery tickets at 45%, instant win at 18%, cards, board games with family and friends at 7.2%, video lottery terminals such as slot machines. So if I pull those 2 pieces of information out of this report, we can still assume quite safely that an expansion of gaming tables and slot machines in the city of Ottawa will contribute to an increase in problem gambling. Is that correct?
Councillor, I think one of the notes, I appreciate the question. I think one of the other notes in the report indicates that an expansion of gambling opportunities in Ottawa could have further negative health and social implications of some individuals who gamble, their family and communities. And then that's why we're looking to put forward a public health approach.
Okay. But again, just on page 10, just to be clear, I'm not sure that I completely agree with Member Taylor when he said, we're we're focused here when all of the trouble is happening over here with people, gambling at home, online. The forms of gambling that are most problematic, it says so right here in the report, are those with the illusion of skill or the experience of almost winning, and that is slot machines and gaming tables as per land-based gambling. Is that correct?
That's correct. And as a note, we're also seeing some initial research encouraging about the youth. Sorry, I can't find it in the report right now, but the youth and online gambling as well.
Absolutely, and I don't question that at all. I just felt that we were getting away from the concern that we should have, and I hope that we continue to have, about land-based gambling.
I appreciate the question, and I think what we're looking at is definitely looking at the land-based aspects of it as well as the broader aspects of it. So I don't think that we're going to be looking at like just one or the other. I don't think it's going to be a dichotomy. We're going to be looking at a fulsome approach, taking into consideration where the most harms are, but also who's at risk. And I think one of the things that we've kind of heard is that it's not going to be that clear cut, but the land-based aspects of it, as Catherine noted, is going to be one of our pieces of the puzzle. We've seen some real successes from the committee over at Lac Limi, and I think that we're looking to include that in the network, and that's probably going to be some of our kickoff pieces, and then kind of broaden it to some of the other aspects.
Thank you.
Anyone else? Any other comments? Dr. Kapoor?
Building on that and the comment I had made earlier about sources of funding. So it's a recognize that, and I'll go a little bit beyond the could, that an expansion of access to gambling locally is going to result in more people having problem gambling. So if we're seeing that that's going to be part of it, I'm asking through you, Chair, what would be the mechanisms to start? Who would be having those conversations with the service provider about making a contribution to mitigating the harms from the expansion? Through the network, as partners in this network, I'm assuming it may have to be OPH that starts those conversations, and I just want to hear more about how that would occur.
Sure, through you. Absolutely, it's Ottawa Public Health that would be pulling people together. That would be a secretariat to the network. That's what's proposed. We would be asking all partners about how they can contribute once we establish some shared goals and priorities. And it is where I think we've heard OLG share tonight that they would be able to contribute in different ways. So contribute data, contribute information, contribute their messaging, contribute platforms. So that is the forum, and it would be OPH that is working on supporting that network. Jillian, did you want to add? No.
Did you want to add anything, Jillian? Thank you. Is that okay, Dr. Kapoor, the response?
Okay, when we hear back, or when a board hears back, I'm going to ask specifically that include financial contribution from the various partners, but most especially OLG and the service provider.
That's noted with staff. Thank you. Anyone else? Okay, seeing none, I just want to add a couple of my comments before we vote on the motion from Member Taylor. In terms of, first of all, I want to commend Jillian Conley and her staff, along with Dr. Etches, for an excellent report that she's presented this evening. And I know there's been a lot of work that's gone on behind the scenes on this report, including a couple of meetings with the proponents, as well as the fact that, when we asked for public consultation from the proponent, they did oblige to 2 open houses that were held in different parts of the community. And I want to thank them for that process, recognizing the fact that they had no other choice in terms of other than holding those public meetings. So I do want to thank them, to recognize their efforts, but I also want to thank our staff for pushing the button a little bit more than just asking for their opinions in terms of, you know, what needs to be done with this public consultation or what needs to be on the report. And as we heard from Ms. Catherine earlier, that the board or the staff did consult with the community partners, and quite a few of those community partners may not have come in to speak this evening, but their thoughts and their comments are included or should be included in the report. In terms of the numbers that people have talked about over the last, you know, almost an hour and a half, the question that I have for Dr. Etches is the plan that everybody talks about, the 10-point plan that was put in front of council in 2013. And I'd like to hear Dr. Etches' response on that, and if Jillian wants to add something to it, where is that 10-point plan? Is it part of this report? Was it considered in this report, or are we creating a new 4-point plan?
So the 10 points were absolutely considered, and we looked at how they could be addressed as part of this plan. So they in 2013, the focus in terms of trying to mitigate the harms from gambling was on gambling activities, a gambling environment only, and the policy approaches related to that. What we've seen happen since then is an understanding that gambling harms happen across the population in many different forms of gambling. So our approach now is broader, but it includes working on the gambling environment. The 10 points we have connected to and looked at how they align with the new RG Check accreditation program that OLG spoke about tonight. And that is an accreditation program that looks at what's happening in the gambling environment, so the same kinds of principles. We've reviewed that, and we've also gained the commitment of OLG to have that information shared about how the RG Check program is working in Ottawa and the results, and how we can use the network to continue to improve results on the accreditation program.
Jillian, did you want to add anything?
No, thank you.
All right, thank you very much, Dr. Etches, for that comment. In terms of coming back to this report, and I, as chair of the board, firmly believe in what the report recommendations are of the 4-point plan. I think the 4-point plan incorporates the previous 10 points that were mentioned by council, as Dr. Etches mentioned, and this just sort of expands those 10 points a little bit deeper and a little bit further. The part that really is worth looking at is the people that did this report, not only from public health, but from our partners' perspective. They're recommending this evening to ask for a reasonable, responsible ask from the province. Something that I think we could, we probably will achieve. If we go and ask for anything higher than that, the success rate may be very limited at that point. So I think, as you may see with the motion that's coming forward, that start off at this level and see where that takes us going forward. As both OLG as well as Dr. Etches mentioned earlier, that there is room for moving forward with a small ask for now, and going forward in terms of maybe a bigger ask next time, depending on how we need or what services we do need. And as you heard through the comment period this evening, that some of these items were discussed through the report presentation and through the compilation of the report. So I think OPH staff have done a great job on this, and let's follow their recommendation if we agree to it, and see where that lands us in the future with the province and with OLG going forward. So over to you, Member Taylor, for putting your motion forward.
Thank you very much, Mr. Chair, and a quick shout out to Member Kapoor, who helped me wordsmith this a little bit. So the motion is that the discussion section under recommendation 2 of the report be amended to replace all references to the ask of the province for $150,000 and $200,000 respectively, to reflect an initial minimum request for $150,000 one-time or interim funding, and an initial minimum request for $200,000 recurring base funding, the amount of such to be increased as Ottawa Public Health data on the scope of this issue grows.
Any comments or question on that motion? If not, can we carry it? Carried. Thank you. So moving on to the next item, and that's Member McKenney's motion. Do you want to put that argument forward?
Yeah, absolutely. So good discussion tonight. I think that, we've certainly have a clear understanding of the scope of the problem within our community, both for land-based and online gambling. But we are a Board of Health, and our primary concerns are disease prevention and health promotion. And we know we have the evidence in front of us that an increase to the access and availability of gambling hurts people, and it hurts often the most vulnerable people in the community, and who are, we're not reaching through our outreach. We're not reaching, we haven't over the last 10 years reached out, reached to those people who we know are at risk and are, exhibiting problem gambling. So the reason for my motion is that, as I kind of looked through the report over the past week, especially this weekend, and really considered, I think that the 4-point plan is a good one. We are going to likely have an increase in gambling, so we might as well do something about it. But as a Board of Health, in 2013, we took a bit of a stronger stand in the recommendations. It wasn't us, but the board of the time, and right in the recommendations stated their opposition to an increase in gambling. So that's what this motion does, Chair, is it just reiterates that our ongoing position against the increase to the access and availability of gambling in Ottawa. And it will give me some comfort in accepting the 4-point plan going forward.
Thank you very much, Member McKenney. And I'm just going to turn to legal for a legal opinion on the motion from Member McKenney.
Through the chair, so the motion that's currently before the board, the operative part of the motion is that the Board of Health reiterate its ongoing strong position against increasing access to and availability of gambling in Ottawa. So that very that be it resolved clause, as Member McKinney had mentioned, also was adopted or was previously adopted by the board in August of 2013. In fact, if you look at page 5, just at the bottom of page 5 to the top of page 6 of the report that's before the board today, there's reference to that that recommendation. It was recommendation 3 in August of 19th of 2013 of that board meeting, and the recommendation 3 was approve Ottawa Public Health's position against increasing access and availability of gambling in Ottawa. So my interpretation of this is that the therefore be it resolved clause, the effect of it is identical to the previous August 2013 board resolution. And in the context of that earlier board resolution being of a very general policy statement nature, I'm of the view that essentially, strictly speaking, the motion is not necessarily out of order, but the motion isn't required in the sense that the board has already taken this position. It's only, in the words of the councillor's motion, it's only reiterating a previous position. So, in other words, the result of adopting this motion or not proceeding with the motion
Mr. Chair,
Sorry, continue.
Just a point of order,
Yeah.
Mr. Chair. This is a board member who, in this context, were a new, this motion was approved in 2013. That was under a different council, a different board. So the member is bringing this forward in this new term. So, I don't know where legal is going with this, but to me, the mover of the motion clearly articulated that it was reaffirming those objectives, and not sure what we're trying to accomplish here beyond. We have a motion on the table. Is it possible to vote on it?
Member Kapoor.
To reiterate or reinforce Councillor Fleury's points, what I heard clearly, the motion is not out of order. Therefore, I believe it would be appropriate for us to consider it.
Thank you for that. Anyone else? Member Kakish.
Just like to ask a question of staff. We just passed and approved the 4-point plan that staff recommended, and I kind of see this as a contradiction to that. I mean, we can keep our heads in the sand and pretend like there's no gambling issues or problems out there, or we can say, here's a solid 4-point plan that we believe in, and we're going to be proactive about this, rather than, saying that, that we don't want any gambling at all when we know gambling is going to be there. So I'd rather be pragmatic about what we're doing here, and so I'm just interested in staff's perspective about how they see this motion, because we just approved a report with a concrete plan of how we're going to address that.
Point of order, Mr. Chair, point of order.
And Councillor Taylor's amendments.
Mr. Chair, just point of order. We have not voted on the report yet. We voted on Councillor Taylor's motion. Is that correct?
That is correct, yes.
Right, but when we do approve that report, I see this as contradictory to approving that, and how do staff see those two things before us?
There isn't a contradiction in the wording. The actual wording that Ottawa Public Health is against increasing access to and availability of gambling in Ottawa is in the report in 2 places. It's there speaking to the 2013 position, and it's reiterated in the discussion.
So it's not contradictory, it's redundant, as the legal was trying to tell us, but you cut him off. So, okay. So I'll be voting against it then.
Thank you very much, Member Kakish. Member Taylor, please.
Thanks very much. I'm not a big fan of, motions that are redundant, or motions that are repetitive, or motions that are, aspirational in nature. I'm a pretty practical person. I like to approve things that we actually believe are going to get done. The one exception, I think, to that, ironically, is where there's a principle at stake, and just about everything that the Board of Health does is principle-based. At least we begin from a position of principle. And I think there are many places and cases where Ottawa Public Health says over and over and over in reports on different places and in different, on different topics that, look, we'd prefer if no one misused alcohol, but they do, so here's our harm reduction suggestions. We'd prefer no one misused drugs, but they do, so here's our our practical harm reduction approach. I don't see this as being any different. I'd prefer if there was no gambling. But if there's going to be gambling, then we have to have a practical plan to tackle the challenges that are going to be faced by problem gamblers. So I'm happy to support this. I don't see that it conflicts at all. I think if we were, this simply states that if we were living in a perfect world, and we believe that, we'd like to, we wouldn't have gambling, because then we wouldn't have problem gambling. But we do, and thus the last 2 hours that we just discussed how we practically handle that. Thank you.
Thank you very much. Member Kapoor.
As Councillor Kakish says, we're living in the real world. This real world, and we're not operating in a vacuum. This real world includes a real, immediate and pressing issue, issue of possible expansion of access to gambling in Ottawa. And in that case, I think one of the ideas of public health, we were talking about harm reduction, but before harm reduction comes prevention. And we did this with alcohol. We talked about low-risk alcohol guidelines, but we also pushed back against the government when the government of Ontario tried to say we want to expand alcohol and make the burden of harm reduction worse. We as a Board of Health pushed back, and we told the government of Ontario, you don't talk out of both sides of your mouth. You don't make it harder for us to, don't increase the burden of harm reduction that we're going to have to deal with. That's a real issue outside today in Ottawa. So I think that reinforcing a position that we took in the context of the real world is appropriate, and I agree with Councillor Taylor.
Thank you very much, Member Kapoor. Member Chernyshenko, please.
Yes, thank you. I'll just pipe in to say similarly to Councillor Taylor and Member Kapoor here and perhaps many others, sure, there's a risk of being redundant or repetitive, but we're faced with a case where we're highly likely to see a large expansion of gambling availability in this city, and by passing this report, it could be perceived, misperceived, characterized as, yeah, we're good with that, but just please try and, deal with the addictions a little bit better. I think it's an important moment to say, no, we still don't believe gambling's a good thing for society. We're still very concerned about the addictions problems and cost to society. But if you're going to do it, this is what we recommend. So that's how I see it, and it's why I guess I do not find it redundant, but rather underlining, underscoring, emphasizing the report. Thank you.
Thank you very much. Anyone else? Seeing no other comments, could we have ask the Secretary to have a yea, nay, a vote on the motion? Or is carried? Carried. Dissent by Member Kakish. Okay, so the motion's carried. Thank you. In terms of the report as amended, carried. Thank you very much. Good discussion. Moving on to item number 5, which is the, thanks again, Jillian. Moving on to item number 5, which is the regulation under the Smoke-Free Ontario Act for Cannabis Act. We do have one public delegation, and we'll invite the delegation to come and speak to us. Her name is Carol McDonald, and she's from the Ottawa Council on Smoking of Health. Good evening, Ms. McDonald. You have 5 minutes to present to the board, and thank you for joining us this evening. Could you turn, yeah, there.
Oh, thank you for allowing me to present this evening. I'm presenting on behalf of the Ottawa Council on Smoking or Health.
Could you pull the microphone closer to your...
Sure. How is that? Well, I've got laryngitis, so excuse me. I'd like to say that we strongly support the recommendations submitted by Dr. Etches in response to the Ontario government's public consultations in March about the use of tobacco, cannabis, and electronic cigarette products under the Smoke-Free Ontario Act and the Cannabis Act of 2017. In fact, we also put forth similar recommendations, but we also included the need to prohibit the smoking of cannabis in indoor and outdoor places, workplaces, and multi-unit housing. We're hearing from our neighbors in Ottawa. They are living under horrible conditions, and I brought 6 excerpts of letters that we've received for help. J.E. writes, chain smokers moved in next door and down the hall. I can't describe the effect it has on my physical and mental well-being. I breathe in toxins that irritate my eyes, nose, throat. My hallway is often filled with smoke. My manager says that she can't do anything about the smoke, but if anyone makes noise in our building after 11 p.m., they can be fined or evicted. How is it that in 2018, knowing the serious health effects of secondhand smoke, I live in a world of smoke, both in my apartment and downtown sidewalks? This is AJ writes, we've been suffering through a constant intense onslaught of marijuana smoke and the smell from this downstairs apartment. She's reached a breaking point. Her daughter has been up at night with headaches, and she's been hospitalized due to severely exaggerated asthma. I mean, I can't imagine living in such a situation. AH has been renting her apartment for 26 years. Currently, the smoke is much worse at all hours of the day and is from more than tobacco cigarettes, which makes my apartment intolerable. I assume it is marijuana, but I'm not sure. I'm thinking of moving, but it's expensive. CM writes, beginning in the summer of 2017, my apartment, including the building, has been infiltrated with marijuana and tobacco fumes. My life has been turned upside down. I have asthma, and I've had to increase my use of my 2 types of inhalers. GW, I've been awakened by a strong smell of smoke and was sick to my stomach. I cannot work many more years. KL, I live in a townhouse where the owners beside me smoke cigarettes as well as marijuana. I have no control over being able to live in a healthy, smoke-free environment. What do these complaints have in common? Residents are experiencing severe and life-threatening physical, emotional, and mental health effects. Individual and families lack the resources to move. Landlords and property managers have failed to protect residents. The province of Ontario has failed to protect tenants and condo owners. The public health crisis will worsen after the federal government legalizes marijuana in 2018. The inhalation of smoke is harmful to lung health as combustion of materials release toxins and carcinogens. These are released regardless of the source, whether it's burning wood, tobacco, or cannabis. And as Dr. Farron said to this committee, lettuce. The confirmation of the presence in both mainstream and side-stream smoke of marijuana cigarettes, of known carcinogens and other chemicals are important information for the public health, and the communication of risk has to be sent on. Cannabis, this is a very recent study. Cannabis was associated with increased initiation of, persistence of, and relapse to cigarette smoking. Consider that 10% of all Champlain residents had asthma in 2012, and COPD is the leading cause of hospitalization in the Champlain region. And it's one of the top 3 reasons for hospital readmission within 30 days. If the province of Ontario does not regulate smoking and vaping indoor and outdoor spaces in multi-unit housing, what can the City of Ottawa and the Board of Health do to protect residents from secondhand smoke and vapor from tobacco, cannabis, and electronic cigarettes? And I know that there are enough smart, dedicated people to health at this board and at City Council that can make a difference on this issue. Thank you.
Thank you very much, Ms. McDonald, for your presentation. Any questions? Councillor Kakish, please.
Thank you, Chair, and thanks for your presentation. And certainly I've expressed my frustration in the past about how the province is going around this in terms of consulting about public spaces and the opportunities to smoke there, when we've just basically shut all those places down recently with the hookah lounges and others as well. And I'm just wondering if you have any sort of involvement or discussions with provincial representatives, or what kind of advocacy and lobbying you might be doing at the provincial level.
Well, if you checked our website, the Smoke-Free Ottawa, we've sent many position papers to the province asking them to regulate the smoke. I mean, this is not about the cannabis product, it's about the smoke of the cannabis product that is going to affect all of us, really.
And have you had any responses to the many papers that you've given to the
I think that,
province?
Personally, I think that with the changing landscape in Ontario, it's very volatile at the moment. One of the candidates wants to have it sold, recreational cannabis sold in stores with, So you have to think that it's going to increase, and it would do well. I just flew in from Victoria today, and the Capital Region in Victoria has harmonized all their bylaws to include cannabis smoking, and I think that's a position that we could take quite easily as well. But there is an opportunity to press forward on multi-unit dwellings. We could look at the noise, how the noise bylaw works. We could look at putting some regulations into licensing of apartment buildings to put some pressure on landlords to create smoke-free environments. And most people even smokers want to live in, when they experience it, they don't want to go back to being in a smoking environment. And up until now, cannabis has been illegal, so there's no grandfathering in of cannabis smoke. It's been illegal, so we can just start off right now and make it the law that no one smokes cannabis in their multi-unit dwellings.
So you want us to play a bigger role in terms of enforcement through bylaw or through updating bylaws by working with landlords?
Yeah, and that would be extremely helpful for our neighbors.
Okay. Chair, are we allowed to, on this, ask questions of staff, or if there's any updates on that front in terms of working with bylaw and enforcement in multi-housing units?
Sure, you can ask Dr. Etches with some questions
That's
if you
not
have.
the only question there.
Thank you for coming tonight and your support. The position on multi-unit dwellings was put forward to the province as part of a consultation. So at this point, it's not for enforcement, it's for consideration in the context of other aspects of the regulation of cannabis and smoking that the provincial government's currently looking at. In terms of our collaboration with bylaw as the landscape evolves, that is happening right now. There's another meeting tomorrow. We're going to have to wait for some more details and react to them to know specifically if this piece about multi-unit housing is addressed in some way by the province. But currently we are looking at how to work with bylaw, work with police, many city partners on the anticipated landscape once legalization is in place.
Are there any updates on the public spaces and opportunities for consumption in lounges and that sort of thing that the province was asking for input on? Have we heard anything back? I think
nothing at this point.
Okay, thank you, Chair.
Thank you very much. Member McKenney, please.
Just a quick question. Thank you, Carol. I hear from people often with very, very similar stories begging me to help them move. And often they're the people who can't move. They're often, folks who have been living in the same apartment. There's a bit of rent control, and their opportunity just to get up and move somewhere else is not available to them. And often with kids and other health issues. So it's something that I'm really pleased that we're finally addressing, smoking in multi-residential buildings especially. And I was happy to see the submission, from OPH include both, tobacco and cannabis. And I will, if it doesn't come through the regulations from the province, certainly we'll want to see the city move forward. We've done that before. We've been leaders in smoke-free Ottawa at the time, and I think that we can again. Can I just ask, in terms of the council's position, do you take a different position with smoking cannabis versus smoking tobacco in multi-residential in terms of phasing in, or is your position that they both should be treated equally?
We'd like to see both treated equally. However, as you know, with the Ottawa Public Housing, they've had to do some grandfathering in legally for some of the leases. That's why I mentioned that it could be a two-pronged thing, one for tobacco moving ahead and cannabis right off the bat.
Okay. So that would be a position of the council if that was our only option.
Yeah, ideally, I would
course.
like to drop the grandfathering if we could get around that somehow, but
Okay.
I'm not sure.
Thank you. Thanks for coming out.
Thank you.
Anyone else? Seeing no other comments or questions for you, Ms., for coming out this evening, and I do appreciate your effort and time. The question that I have for you, and I think Councillor McKenney touched on it, is there are so many other partners out in the community that we may have to deal with in the future. One of them is being condo boards. Have you approached any of those partners at all to say, how are you going to handle those kind of issues and other landlords?
Yes, more on an individual basis, because we do get complaints from condo owners, or owners. And so we talk to them about what the process is. Actually, condo owners have a little more leverage than renters, because there is a process that they can go through their board, vote on a bylaw, and have it come into effect. So we try to encourage them to look at these processes. But it's more for the individual condo owner. And keep in mind, we are a very small group of volunteers.
Thank you for that. And as you were well aware, that City of Ottawa took a very strong stance against smoking a number of years ago. And we were very successful in that. And I don't know I can't speak on behalf of everybody on this board table, but I, for one, do not want to take a back step to that policy. But I also understand the realities that this piece of the pie really is in the provincial hands at the present time. In the future, it will come forward, and I'm sure the Board of Health, as well as the Ottawa Public Health, will make a submission as we have done already. So thank you again for coming out. And I appreciate your comments. Thank you. So to the members, is the report received? Sorry. Member Kapoor?
Thank you, Chair. A question to either Dr. Etches or legal. In terms of the status of the SFOA regulations, the comment period ended about a little over a month ago for the SFOA 17 regulations. And previously, I think it was at our November meeting, or in the fall Q4 meeting, we identified that there were gaps in the city bylaw. And I'm just trying to understand, when does the SFOA regulations that were proposed, do we expect that they're going to take effect? And therefore, when are we going to be able to analyze those new regs along with the city bylaw to identify gaps that require correction?
Yeah, sorry.
Okay. Omar will address that first.
Yeah, so through the chair, the member referred to the consultations conducted by the province. The consultations were on content for proposed regulations. The province proposed regulations under the new Smoke-Free Ontario Act 2017, which would not come into force until essentially cannabis is legalized and everything is prepared to have the new cannabis regime in place. So that date is still in question. The federal legislation is still before the Senate. At the provincial level, you have the new Smoke-Free Ontario Act 2017, which is not in force. You have no regulations that have been filed yet. So nothing has happened in the past month. And so in short, there's no news, and the expectation likely is that provincial regulation won't be filed until there's more certainty about the status of the federal legislation. So it may still be some time until we see what regulations the province is actually going to file in respect of the new Smoke-Free Ontario Act 2017. So the short answer is there's still a lot of unknowns about this legislation, but the general expectation is that there'll be a new Smoke-Free Ontario Act 2017 that will at some point replace the existing legislation, and that new legislation will cover medicinal cannabis, as well as electronic cigarettes and tobacco, and possibly in the future any prescribed substances or products. Subject to any question.
It goes a long way. So there's been a lot of preparatory work. Are there any signals from the government that once the cannabis is legalized and once the federal legislation is brought into force, that the province is planning on doing it, planning to implement those on the same day, or have they given any signals on how long afterward they intend to proclaim the legislation and implement the regs?
Typically, the process is intended to be seamless. I can't speak for the province, of course, but the process is intended to be seamless. So on a certain date to be determined, the new legislation will replace the previous legislation, and you'll be under the new regime, so to speak. So that's my understanding of the end state.
Okay. The purpose behind the question, as if it wasn't clear, was we'll have some lead time. We don't know how much for when that happens, and we might as well take advantage of that lead time so that we are able to, as the city, see what, if anything, as the Board of Health, see if we identify any gaps between the federal, provincial, and municipal legislation and bylaws, so that we're ready to, as soon as possible after those changes occur, make any necessary, recommend any necessary revisions to what's under our control in Ottawa.
Thank you very much, Member Taylor. And Dr. Etche, do you want to make any comments?
Yep, I got that. Thank you.
Thanks very much. And again, just to come back to your point, Dr. Kapoor, that in terms of this process going forward, it's still at the starting stages at the present time with the province in terms of the cannabis issue. We need to have our interjection into that process, and I totally agree with you on that. So thank you for that. Member Fleury, did you have a comment?
I'll be very brief, Mr. Chair. Just want to address the speaker's comment around multi-residential, that we are working with the medical officer of health, and we do have Councillor Taylor and Councillor McKinney, or our board members like myself at Ottawa Community Housing, and we're pursuing discussions with the province and the board level to see what we can put in place to protect our tenants' health, but also the well-being of our buildings. So point one. Point two, I do sense a gap in between what we're speaking here as a board in respecting fundamentally the Smoke-Free Ontario Act and what the city's put in place in bylaw, and the objective of the Ottawa Police. I've recently spoken to Ottawa Police, and obviously for them it's the consumption and the risk of folks driving, which I can totally understand and respect. But for us, what that does is it adds an element of conflict relating to the public realm, especially around sidewalks. So if our goals are to reflect the Smoke-Free Ontario Act, it means don't smoke in your own unit. The only way where you can smoke is really on sidewalks. Police aren't as open to that discussion and really would like to see the use in units. So I wonder if we could ask the medical officer of health to maybe meet with Ottawa Police to sort of see what can be done to align the City of Ottawa's position in this regards, because I do sense a bit of conflict or a bit of different objectives. And finally, Councillor Kakish touched on some of the elements relating to the vapor lounges. Is it possible that Ottawa Public Health also pursue discussions proactively with our zoning team at the city if the province does proceed with the vapor lounges, so that we can be proactive in terms of zoning of those lounges, if that's the way the province decides to go?
We have been in contact with the OPS, and we can revisit the particular issue you're discussing. We can take that up. And as for vapor lounges, your interest is in working with bylaw on a new bylaw, if
To see if we would have a specific zoning group for that use. If the province does head in that direction, you wouldn't want to see vapor lounges in just adding up in certain parts of the community or on a specific street or in a certain community. So it'd be interesting to see from a pure zoning compliance point of view if there's a zoning type that the city or urban planning would prefer. So maybe proactively we can engage them in that conversation.
Yeah, definitely.
Okay, thank you. And anyone else? No? Thanks very much. So can we carry that report? Thank you. Okay, moving on to motion to adopt reports. Member McKenney, please.
Be it resolved that the Chair of the Board of Health's verbal report, the Medical Officer of Health's verbal report, Ottawa Public Health's 2017 annual report, the Public Health Approach to Reducing Harms from Gambling in Ottawa report, the Acting Medical Officer of Health submissions to propose provincial regulations under the Smoke-Free Ontario Act 2017 and the Cannabis Act 2017 report, the Ottawa Public Health Emergency Preparedness and Response Report, the Planning Approach for a New Public Health Strategic Plan 2019 to 2022 report, the 2017 Operating Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, the Delegation of Authority, Contracts Awarded for the period of July 1 to December 31, 2017 report, the Attendance at the Association of Local Public Health Agencies 2018 Annual General Meeting and Conference Report, the Election-Related Resources Policy Report, and the report from the Sponsors Group on the recruitment and selection of a new Medical Officer of Health be received and adopted.
Is that carried?
Carried.
Thank you. Motions of which notice has been given previously. I have none at this time. Motions requiring suspension of the rules for procedure. None at this time. Notice of motion for consideration of subsequent meeting. Anybody have a motion for subsequent meeting? Seeing none, thank you. And inquiries and answers. We have none at this time. Confirmation bylaw. Member McKenney, please.
Be it resolved that the confirmation bylaw number 2018-2, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of April 16th, 2018, be read and passed.
Is that carried?
Carried.
Thank you. And motion to adjourn the meeting? Okay, anybody suggest? Thanks very much, everybody, and thanks for joining us this evening. Take care.